Chukwuka UM, who is presenting his work on crowdsourced image-based mobility hotspot surveillance for neglected tropical diseases, development and pilot of a new surveillance method for neglected tropical diseases. You have 7 minutes for your presentation.
Thank you, Prof. Good morning, everybody. Good morning, House. So, Dr. Uche Chukwuchukocha, incidentally, is not around, is away in London, attending to another conference. My name is Ayola Oluwaseun-Bosede, is doctoral student. So this morning, I will be talking on our project titled Crowdsourced Image-Based Mobility Hotspot Surveillance for Neglected Tropical Diseases, Development and Pilot of a New Surveillance Method for NTDs. Next slide. All right, thank you. This is a great house of parasitologists and our public health experts, so I will not be teaching you about neglected tropical diseases. You have done it all through your life. But it is important that I mentioned that according to the WHO, currently about 1.6 billion people are at risk of contacting any of the 25 known neglected tropical diseases. And it will also interest you to know that in Nigeria, over 580 local government areas out of the 774 that we have are exposed, endemic with one or more of these neglected tropical diseases. Now, these diseases have been largely neglected for very long, hence the name neglected tropical diseases, until 2010 when the WHO came up with the first framework to tackle the disease. And with the help of that framework, currently about 60% of the exposed no longer need drug for some of these diseases, and many diseases were eradicated with the help of that framework, including drunkeliosis, again one disease that was eliminated in Nigeria in 2013. But more has to be done, and that was what led to the development of another framework in 2021 that is tagged Ending the Neglect, a framework to end neglected tropical diseases and achieve the Sustainable Development Goals 2021 to 2030. And in this framework, surveillance stood out as a very important approach to tackling this disease. And now, in Nigeria, the surveillance for neglected tropical diseases are largely lacking from the stress it requires for surveillance officers to go into remote areas where these diseases are endemic to look for cases, leading to large cases of situation of underreporting and the rest. So our research lab came up with this idea that we call the crowdsourced image-based mobility hotspot surveillance. The idea is very simple. What we do is to leverage the smartphone technology and the availability of mobile communication network in many communities in Nigeria. When you go to the most remote locations in Nigeria, you discover that either one of the popular networks is there. If M10 is not there, Glo will be there. So what we did is that to engage and sensitize these community members. So whenever you see any of these unusual manifestations on yourself, either in the eyes or on the body, produce your smartphone, take a snapshot, send to us through WhatsApp or Telegram, a platform that many people in Nigeria are very familiar with. And when this comes to us, we now aggregate these things, send to our group of experts. They are experts in parasitology, public health physician, dermatology, ophthalmologist. 5 of them, they will receive these collections individually, and we'll make them to provide a diagnosis on the picture that they receive. And if 3 out of the 5 experts say that this disease, for example, is onchocerciasis, and that is the condition. And I also let me mention here that there is a WHO handbook on how to recognize skin entities by changes on the skin. Because some people will be wondering that how will people just look at the skin and say this is this. It's possible because of the different manifestations of this condition. And when the experts, when they have done their annotation, as we call it, will now use these results to generate hotspot map of the NTDs, demographic and geographic distribution. Next slide. Now, this project was piloted in 3 states in Nigeria, Ondo State, Enugu State and Cross River State. And we also have our control state, Enugu State, Akwa Ibom State, that we are currently, Imo State and Ogun State. Next slide. All right, the approach is very simple. We had a lot of advocacies, permissions, and the rest that led to us having access to many communities that we visited. And this is where we do community sensitization using our IECs, signposts, flyers, just to tell the community members the different manifestations that they can see. And when they see it, take your snapshot and send to our database. And also, we have a group of people in every community that will go. We call them the community contact persons, CCPs. The function of these people is very simple. What they do is, we know in many rural communities, people lack access to smartphone. And this system, for it to function, there must be smartphone. So the CCPs are the people that the community members will call whenever they see this unusual manifestation, to take the snapshot on their behalf and send to us. Next. So we have some interesting results. In Ondo State, in the space of 4 months, we received 217 images, 175 of which were confirmed to be different types of NTDs. In Enugu, we received 153 submissions, 105 was which confirmed to be various forms of NTDs. All right, so this is the breakdown of what we got. Total 512, annotated by experts, 512, confirmed NTDs, 386. We got some unclear pictures, some unknown conditions, and some cases that are not NTDs, like glaucoma and the rest that people sent to us. Next. All right, using the SIMS NTD approach, the data that we collected in the space of that 4 months, we compare with the data that traditional approach collects in that same instance of 4 months. So you can see the graph. That is the SIMS NTD report that is at the top. Then in the 3 control states, this is their own traditional surveillance approach that they use. So we got an average of 21 reports per week compared to two reports per week that was obtained through traditional surveillance approach. And this is the distribution of the various NTD. We have 187 cases of onchocerciasis, some cases of trachoma. It will interest us that we also discover a large number of trachoma in southern Nigeria, because there is this belief that trachoma is limited to the north. Now, we saw a large number of trachoma, but we don't know if they are imported cases, if those people just came into the south and they were captured, and work is currently ongoing on that. Next slide, please. All right, we were also able to use the data that we got to generate a hotspot map of these various NTDs. If we have close access to this map, those are the keys that indicate different types of NTD and where they are found in the study location. Next. All right, so on the sideline, we conducted another study leveraging our CCPs. We trained them 3 months after the project to be able to get data on the user satisfaction, the user friendliness of the SIMS NTD approach, with many of the community members confirming that the system is easy for them to use and they enjoyed it. Next. So, in conclusion, the SIMS NTD approach has shown potential to enhance the surveillance for NTDs in Nigeria and beyond, and we advocate for its wide adoption and deployment so that we can collectively end this scourge of NTD C30 as earmarked by the WHO. Next. All right, we want to appreciate our partners and sponsors. The project was graciously sponsored by the Bills and Melinda Gates Foundation, the Cross River State Ministry of Health, Ondo State Ministry of Health, Enugu State Ministry of Health, the Federal Ministry of Health, and every other people that partner with us. Thank you very much.
Thank you very much, Mr. Oyalo. It's not easy to be the first person to baptize the all. Thank you very much. And we take 2 questions on his presentation. Any question? Okay. Since there's no question, thank you very much. They will interact with you later. I call on the second presenter, abstract number 005. Abstract number 005.
Good morning, Mr. Chairman. Good morning, everybody. I am Gloria Nyarum Joseph, here to present a research finding on the topic mosquito-borne arboviral infection in pregnant women attending antenatal clinics in some hospitals within Bauchi local government. And over the years, mosquito researches has been more focused on malaria and malaria pathogens. And it's of recent that researchers have started gearing towards mosquito-borne arboviruses. And the WHO has stated that over 4 billion people are at risk of infection with arboviruses. And then recent report of WHO showed over 11 million people being affected between January and August 2024. And with the deleterious effect of these infections on pregnant women leading to miscarriages and stillbirths, and there is limited research that is ongoing within Nigeria. So we have poor reports of the true incidence of arboviruses in Nigeria. And in Bauchi State, this is the first report that is being produced because there has not been research in this area in Bauchi State. So therefore, we brought up this research with the aim of determining the prevalence of these arboviruses in pregnant women. And we sampled 3 hospitals within Bauchi. That's the 3 major hospitals within Bauchi State. That is the Abasi University Teaching Hospital, the General Hospital Bayara, and the Specialist Hospital. Prior to the research, we actually collected ethical clearance from both the teaching hospital and the Ministry of Health, Bauchi State. And then we were, based on the calculated sample size, we were supposed to sample 365, but we sampled 403 pregnant women. And the blood samples were collected via venipuncture, and we transported it to the Molecular and Genetics of Infectious Disease Laboratory at the Abasi University Teaching Hospital, where the RNA was extracted using the Kaijin RNA extraction kit. And then we now ran a real-time PCR using the Novaplex Tropical Fever Virus assay, which is a detection kit that detects dengue, Zika, chikungunya, and wildness viruses. And the result of that run gave us a total of 4 samples being positive with dengue virus. However, there was no Zika virus, chikungunya, or wildness being detected. Now, this gave us an overall prevalence of 0.99% of pregnant women infected with dengue virus, which is quite huge as compared to the result of Shuaibu et al., who carried a similar studies in Kwara, Ondo, and Delta. And he reported a 0 prevalence of all these arboviruses, except for yellow fever, where he reported a prevalence of 3.3%. But however, there are other few researchers that reported high prevalences, like Mark et al., who reported 44% in Abia, Nasarawa, and Kaduna State. So this is giving us a picture that arboviruses is ongoing, and it's a silent area where researchers need to focus on so as to get a true picture of what is ongoing towards prevention and control. We also checked other factors such as their educational qualification, occupation, and age, and we realized that level of education and their occupation were significantly associated with the prevalence of these viruses among pregnant women. And then checking also checking the gestational months and the trimester of infection, we saw that it is also significantly associated, where we saw those that are within the 2nd trimester being more infected with these viruses. Now, Naushin et al., they reported that pregnancy within 1st and 2nd trimester are always affected, leading to abortions and stillbirth, because the fetal and the placental tissues are being distorted. However, that of the trimester is not, third trimester is not always being affected. So that means there is a danger lurking around which needs to be curbed. We also sampled mosquito vectors because these arboviruses are mostly transmitted by mosquito because we are really dealing with mosquito arboviruses, and which their primary vector is the Aedes species. And when we sampled the mosquito vectors, we actually saw that yes, they are vectors, they are Aedes species. We identified both Aedes aegypti and Aedes albopictus within our community there in Bauchi. So that means there is an ongoing infection and there is a vector there to transmit it further. So putting many people at risk of this infection. So based on the outcome of this research, we concluded that yes, there is a vector, there is at least one arbovirus that is prevalent in Bauchi State, especially among pregnant women within Bauchi State, and also certain factors can be associated with this prevalence of the arboviruses within Bauchi State, and the mosquito vectors are there to transmit these arboviruses. So we recommended that there should be an inclusion of kind of sensitization for since our target was the pregnant women. So our recommendation was to include it in their maybe antenatal clinics on how to prevent themselves from this mosquito bite, because it actually bites between dusk and dawn. And many pregnant women always feel heat and want to come out to take fresh air. So they should be educated on how they can they can prevent themselves from being infected through the bites of those mosquitoes. Thank you very much.
Thank you very much for that wonderful presentation. We take comments or questions, just two. Is there anybody that has a comment or a question? Okay. Stand up. Yeah. Yes.
Okay, good morning, everyone. I'm Abuye Pascal from Delta State University. I will confess your presentation is quite interesting. I'm presenting, I have a similar research work I'm working on. I'm working on dengue and yellow fever. I want to ask, ma'am, you talked about the identification of the mosquito. I want to know if there's any way you can throw more light on it. Since I'm working on, I'm looking at the disease itself, my own research, PhD research work I'm doing currently. So I want to know if there's any possibility for me to identify that mosquito, because I believe if I can identify the mosquito within my area in Delta Central, I could pull through with my work. It will be very easy for me. So if you can give us, or give me, because I need this so much, if you can give me, like, explain more how I can identify these vectors that is responsible for this arbovirus. Thank you.
Okay. Basically, one.
Thank you, Mr. Presenter. This is a very interesting presentation. My own is, have you mind to check the physiological circumstances that the infection is more during second trimester? Thank you.
Yes. Okay, for the first question, it's not even here. We actually identify them morphologically. And some few features I can talk about is their color. Okay, he's here. Is their color. They are dark, they are blackish in color, and then they have stripes, white stripes. That's the Aedes species. They have white stripes It's not here. They have white stripes on their tarsa, and then they have also this line, white lines on their head region. It's not here. It's visited. Okay, for the second question, we didn't really check the physiological aspects. Thank you.
I think just to help her out, for any serious conclusive identification of any pathogen, it has to be molecular. So if you have caught any mosquito, subject it to PCR, and we know if it's Aedes or Anopheles. Thank you very much. So I'll call on the third presenter. Third presenter is,
Chairman of the session, professors in attendance, dear delegates, good morning everyone. I am Sunday Ujo. I'm presenting on prevalence and factors associated with gastrointestinal infections in Maradi breed from major markets in Kwara State, North Central Nigeria. 028, please. Thank you. 028. Thank you. So I'll be presenting on prevalence and factors associated with gastrointestinal infections in Maradi breed from major markets in Kwara State, North Central Nigeria. As way of background, the livestock production sector in Nigeria plays a significant role in Nigerian economy. As we know, well over 80% of Nigerian households, rural farmers, engage in one form of agriculture or the other, particularly in rearing of livestock breeds. Next slide, please. Next slide, please. Of course, the parasite infections often present as mild subclinical conditions in healthy animals. However, the impact on the economic value of these animals is very great. This work investigated the prevalence, distribution, and factors that are associated with the gastrointestinal infections in Maradi breeds, which is a major breed consumed in the North Central, particularly in Kwara State. Next slide, please. We examined 132 fecal samples of these goods in 3 major markets in Ilorin, namely the managed markets, Eyankoni markets, and Ipata markets. 55% of the sample examined were from Ipata market, a major market in Ilorin, and filtration method technique was used to determine the ovals of the parasites in the fecal samples, using zinc sulfate as our flotation solution. Chi-square and other starter version 1.4 software was used in analyzing our data. Next slide, please. Overall, about 9 different species of parasites were observed in that order in the various samples. Next slide, please. As I said earlier, about 162 goods were examined, and the bulk was from Ikot, which is about 54% of these goods were observed from Ikot. And we've observed that 84% of the parasites, of the animals in mandate were infected. 85 from Ipata, and of course, Enya Korin has the lower number of infection. Next slide, please. Next slide, please. The males were more infected than the females. More than the females, giving us about 89% of the males were infected, while about 74% of the 79% of the females were infected. Next slide, please. Next slide, please. By age, 84% of the of goats between age 6 to 12 months were infected. Infection decreased with age, while 50% of those above 36 months of age has 50% rate of infection. Next slide, please. When doing our ratio, I'll discuss this in my discussion. Please, next slide. Whole discussion overall, about 84% or 84.1% of infection was observed across the various locations. Highest being in Ipata markets with 89% rate of infection. This is a value reported by various authors. This may be 75% reported by Ikot and 70.95% observed by Enigwe in Oyo and South Africa respectively. The elevated prevalence of parasites observed in this study may be attributed to environmental and management practices. Next slide, please. Wide independence test did not find a significant association between sex and infection status. The odds ratio for sex, which is 2.48, suggests that male goats are more likely to be more infected than the female goats. This odds ratio indicates that the odds of infection are approximately 2.5 times higher in male goats than in females. This is not far-fetched. As we know, males are likely to be more aggressive feeding than females, and of course, male goats has multiple sex partners running around getting hook partners. Additionally, males may be exhibiting more aggressive feeding behaviors, potentially leading them to ingest more contaminated vegetation or soil. Next slide, please. Also, hormonal differences between male and female goats can also play a role in susceptibility to infection, according to Bajaj 2024. The logistics infection analysis also indicated a significant association between age and infection status, with an odds ratio of 1.96. This suggests that with increase in age, as your age increases, chance of infection decreases by 96%. The highest infection rates were observed in younger goats, as earlier mentioned, particularly in age 6 to 12 months, which was 8.24%, and 50%, about 5% in 13 to 24 months. This trend suggests that younger goats are at a higher risk of infection, which is the internet with observation from other observers. Next slide, please. I would like to conclude by saying that our research shows that, of course, male goats are more likely to be more infected than females, and of course, method of management could also increase rate of infection, while younger goats are more susceptible to intestinal parasites more than the older goats. Thank you.
Number one, I would like to say that it will be better for you to say coprological examination. Because when you use gastrointestinal parasites, it implies that you actually collected the GIT. Did you do that? You didn't do that. Fine. Then number two, did you find the specific trophozoites of some parasites inside the fecal sample?
Thanks, so we did. That was what the first we have, because based on when we did our flotation method, we collected some ovals and of course some larvae that we compare based on using WHO.
No, did you see the adult? The adult?
No.
You didn't. So I would like you to just say coprological examination. Because if you have collected the GIT, I am very sure that you will have seen the trophozoites, the adult stage or stages of those particular parasites. You understand? Then again, I actually agree with you when you said that the young ones are actually more susceptible to parasitic infection. Yes, just by virtue of the fact that those young ones, they don't really have adaptive immunity. There is no adaptive immunity in them, so they will have been able to be more susceptible to parasitic infection. Thank you.
Thank you very much, sir.
Okay. Yes, thank you for that presentation. I want to add to what Prof said. When you recover eggs, ova, whatever you recover from the parasites, it's good to always show us the pictures. The pictorials will really speak volume. So it's very important to also include that. Even if it's at the end of your presentation, at least try and show the pictures. Another thing I want to say is in your discussion, because I wanted to say that your tables look too simple and you didn't show us the statistic you did. Yes, but when you got to the discussion, you started looking at odds ratio, because I wanted to say that you didn't check the association between sex and prevalence of this parasite. So, and then getting to discussion, you mentioned that it's better you indicate. For males, odds ratio 1 point this. For females, odds ratio 0 point this. So that we know that the males are more associated, they are more likely to be infected than the females. So for whoever sees that will now know that, yes, you have used that tool. Because right from in your write-up, you know that for each objective, you have this tool you use. So if you use that tool, you are supposed to show from your tables, yes, to show that, look, this is the result, your chi-square value and so on and so forth. So please, that table need to be, the tables need to be adjusted. Yes, if you want, we can discuss. I can show you some tables that are similar to what you have done that can really help to bring out the quality of those tables. Thank you.
Thank you very much, ma'am. Thank you very much, ma'am. For the old issues, we're mindful of time. Discussion was meant to be discussed based on showing the tables one after the other. I chose to just show the tables and then discuss them thereafter. So thank you very much, ma'am, for your contributions. I appreciate that, ma'am. Thank you.
Thank you very much. We call on the next presenter of abstract number 191. Abstract number 191.
Thank you. Good morning, everyone. Good morning, BOT. I want to stand on the existing protocols. I'm mindful of time, 7 minutes. I'm presenting a work on the Can I be? Okay, I have it here. I have my slides with me, can I talk? Don't worry. Okay. Okay, thank you. So maybe I can just lay the preamble, the reason for this work. This is the burden, is a preliminary report of an ongoing work that we are doing in my institute. I work in NIPRI, National Institute of Pharmaceutical Research, and we are trying to establish the parasitology unit and involve a center for treating NTDs. So we thought we should establish the fact that there is a burden of NTDs already existing. In the institute, we have a research clinic, and we also have a PEPFAR center, IHVN program. Institute of Human Virology Nigeria, where clients, HIV clients, come for their regular treatment and also checkup. So we now want to also establish that there's a burden of NTDs so that we can attract the possibility for the Federal Ministry of Health to give us the medicines, albendazole, ivermectin, that we can use to treat. That this came after we attended NNN conference, where they wanted NTDs to also be part of the routine checkups in hospitals, so that we can justify why we need those drugs to include for treatment to achieve 2030 elimination map of NTDs by WHO. So with informed consent, Ministry of Health, because we have collaboration with them, they gave us a CATOCAT kit, and that is what we use to screen the clients that come for NTDs. We screen for or the ones that we can do using the CATOCAT kit. And I have the burden. Why focus on NTDs? The first presenter told us about the burden of NTDs, and we cannot overlook it. So in every little corner, we try to do our own bit towards the elimination of NTDs. So because it's important in population health, we can also see the global distribution of NTDs, distribution of lymphatic filariasis, onchocerciasis, schistosomiasis, and soil-transmitted helminths. And the objective, like I said, is to establish that there's a burden of NTDs here, and then there's a need to have these drugs for treatment and to make our institute a treatment center. And so it's an ongoing work, but we just compiled for some months now, and I'm presenting it. And then the analysis, in the results, we found out that 50% of clients, we analyzed 90 participants, 90 samples, and we found out that 50% of them tested positive to any or two of the NTDs. And the most prevalent infections was Ascaris. We detected it in 33.3%. We actually have pictures, like the last commenter said. I didn't put pictures here, but we have some pictures of the worms we saw. Still have them in slides. Then followed by hookworm, 11.11%, and other detected NTDs are schistosomiasis species, tinea species, and trichoris. And we also try to check if there's any correlation between the NTD prevalence and demographic factors like sex, age, occupation. So far, we didn't find any in the one we had analyzed. We didn't find any, and this is shown in this presentation. We have also done some other NTD work there, in the institute, but it was majorly on the common snacks, debino and tiger nuts that people eat easily. We tried to check the parasitic burden on it, and we found out that when you buy dates and tiger nuts without washing them, you're taking in an average of 19 eggs, over of Ascaris. They were all highly contaminated, apparently due to handling. And so we now, from this little data we analyze, we are now canvassing that because of public health implications, that NIPRID can be a treatment center for NTDs. Because every day on a daily basis, clients come there. Either they come for health seeking, or they come for HIV, or they come for TB. They come for one thing or the other. So we have a high inflow of clients. So now we are now canvassing that NIPRID can be a treatment center. Research and drug development, that is part of our mandate, to focus on local medicinal plants, develop new treatments, and partner with pharmaceutical companies. Mass Drug Administration collaborate with WHO and health ministries to distribute essential NTD drugs like praziquantel and albendazole. Diagnostic and treatment facilities to build diagnostic labs and outpatient clinics to treat NTD patients. Community outreach and health education, lead public health campaigns and school-based deworming programs in high-risk areas. It's also situated in a local community, in Idu community in Abuja, and there's a lot of schools, there's a lot of activity that we can do there concerning NTDs. Collaborative research, partner with universities and global institutions for clinical trials and large-scale studies. By this also, we are calling for collaborations. Training and capacity building, train health workers and provide research opportunities in tropical diseases. We have also trained a lot of health workers and even students that come on ITs. And then monitoring and evaluation, establish a disease surveillance system and assess intervention impacts. Like the first presenter, that disease surveillance system he presented was also, we can also apply it there. So the findings of this study highlight the high prevalence of ascaris and hookworm among the population alongside other NTDs, underscoring the need for urgent public health interventions. Immediate actions such as community-wide administration of anti-helminthic drugs and hygiene education campaigns are critical to controlling these infections. Furthermore, regular follow-ups and periodic deworming initiatives should be implemented to prevent reinfections. In light of these results, it is recommended that the government empower the National Institute for Pharmaceutical Research and Development, NIPRID, to establish dedicated centers for the dosing and treatment of NTDs. These centers could play a vital role in the systemic and widespread treatment of affected populations, contributing significantly to the reduction of NTD burdens across the region and achieving the WHO elimination agenda. Thank you.
Thank you very much for that presentation. Do you have comment and question?
Thank you very much, presenter. That was a beautiful one. I'm standing on the existing protocol. I disagree with you on a statement you made now, which I feel you should either explain to me or I will give my own explanation. Now, you said that you did not recognize or discover or find a correlation between demography and prevalence. Then I have a question. Your sampling technique, which is not designed, it is based on, informed consent, and it's idiosyncratic because it's who has the need that came to, it's a health sick, need induced. So it means that your sampling and the analysis is skewed because you did not consider the most vulnerable in the population, which are the infants, 0 to 5, the school-aged, the pregnant women. The only people probably who came to your center were informed individuals, enlightened, and if such human beings could have such prevalence at that level, it means there is a very big problem in Abuja. And that Abuja needs some education from the cradle to the old guys. Because nematodiasis is usually more prevalent in 0 to 12. Then how come old men who should be taking good hygienic processes are flashing such prevalence, which is high? Then I'm saying, how now do you make it very, very open to old men and women to access your center? Why the vulnerable are not assessing it? So if you are using such statistics to give us a journalistic conclusion, it's skewed. So what I'm suggesting is that your center should re-strategize to consider the catchment areas and those in need. So that is where community diagnosis should come in. So you should partner with other institutions around, because you don't have the personnel to do what you need to do that coverage, because your program now is a pilot program. Which means that if you now take this skewed analysis and give it to us as a national statistics, it's going to confuse a lot of people. And the interventions you'll be seeking will be lopsided to only a few people, while the need lies in the people who are not even having access to that. And according to the WHO thing, access to health, care is part of the empowerment we're talking about. So my suggestion is that there should be a strategy that your center should, build into community partnership, where there will be sub-centers within the community on educating the people, working with the primary health care facilities that are there, because what you are handling now, it's strictly based on primary health care. And the therapies and whatever measures you're going to take are all on the fulcrum of primary health care. And you can't handle that if you cannot go to the primary health care centers to get catchment and sources of this data you want to present to me. That is my observation and my also advice. Thank you very much.
Thank you very much. I thank you for your observation and your comments. But, I tried to explain that the reason for this is to show that there was a need to attract this treatment. We didn't go out to the community. The community is there. Our institute has a mandate to develop drugs from indigenous plants. But now, being there, a parasitologist, I tried to build this unit. So, if we must do what you said, maybe we have to look for grants, sponsorship, and like you said, collaborators. So we didn't go out. We were dealing with clients that came. People that came for either HIV or malaria or just some other thing, health seeking with informed consent. We try to check their burden. You understand? So what you are saying is good, is true. And I said it's an ongoing work. So we just took the first 90 samples to analyze. Maybe by the time we analyze more, we can now see some relationship between sex, age, all those. But for the children, we didn't, as long as you come to NIPRID, we do, but we didn't go out to the schools around. Thank you.
There are different types of study design. Yes. There is school-based, there is community-based, there is hospital-based. So there is no problem wrong with the study design. No. Thank you.
Yes, I think that is exactly what I wanted to say. But in addition, NIPRID is not out to take over from NTD program. There is the NTD program in the ministry and covers the whole of Nigeria with different branches. They want to be a center for mass drug administration and treatment. That's all they want. They just did this study to justify the fact that the people coming to them for other things, like I know you have Niprisan, Nicosan and all those things, they are also tested for NTD. And now they found that there is NTD in that population that comes to them from everywhere in Nigeria. So they want to be a center to treat and to do mass drug administration. So I appreciate what I can't see who it is, so I don't know, the speaker had said. That is necessary for community-based intervention, which others are doing. But for them, they want to be certified a treatment center. Thank you.
Thank you very much. You can step aside.
And where are you going?
You can still step aside.
And the issue...
Why Prof address you?
I think you are trying to develop advocacy document to Federal Ministry of Health to empower you or give you the leverage to be allocated the drugs to treat PCNTD. I think you have achieved it. Articulate it now with your director or whatever and submit it to the Minister for Education, Minister for Health, through the NTD director. they will now be allocating drugs for PCNTD. I think it's okay.
Thank you very much. We call on presenter of abstract number 143. Abstract number 143.
Good morning, elders in the house, great parasitologists in our midst. Good morning, fellow parasitologists. Good morning, ladies and gentlemen. I am Paja Mofe, and I want to present this work we did together with other co-authors on problems in neglected tropical microparasitic diseases, perception of parasitologists in Nigeria. If we listen to about 3 speakers before me, we're all saying the same thing. How can we eliminate parasites? Most of us talked about NTD. But our own aspect is the microparasites. We have 25 neglected tropical diseases. Let us narrow it to our own aspect. So, what are microparasites? They are large parasites that we cannot see, that we can see with the naked eyes. And we have examples as the nematodes, the cystodes, and the trematodes. And we know the example of the diseases they cause. We have lymphatic filariasis, we have onchocerciasis, we have the soil-transmitted ehrlichiosis, Giancoculiasis, and so on and so forth. We all know this. But why is there still a problem in elimination? The WHO has, we will say, an overarching goal that by 2030, 100 countries should have eliminated at least one neglected tropical disease. So what is our position? What is our perception as parasitologists? What can we do? That is the aim. That is the aim of, or that was the aim of this project. Now, like we all know, we know the mode of transmission of these diseases. We know how it can be controlled. It's not something new. So what then can we do as parasitologists towards this elimination goal? WHO has that by 2030, we should, 100 countries should have been able to eliminate at least one NTD. Let us narrow it to Nigeria. We have it in our roadmap, according to Nigeria Ministry of Health, the Federal Ministry of Health, the NTD wing, that at least we have one NTD should be eliminated from the 774 local governments that we have come 2030. So what do we do? Now, what are the problems in neglected tropical diseases? We use this method. I'm sure some of you will remember that you filled a Google form for us, and you told us what you knew, and you told us what the problems seem to be. And what are the problems? We said, 1, lack of awareness and visibility. Another one is limited research and development. Lack of ownership and political will by government. Socioeconomic factors too. Socioeconomic factors. lack of public health infrastructure, fragmented control programs, climate change and ecological factors, and also we said poor personal and community hygiene. These were the major problems that we found that could impact the successful control and elimination of neglected tropical microparasitic diseases. Remember, we narrowed it. It's a subset of the NTDs. So what is the solution we can proffer as parasitologists? We have done, many of us who have done researches, some of them sponsored by partners, but majorly, according to our result, were self-sponsored. And you know what? The implication of that, the implication of that, money coming from our own pocket. We might not really do much. You see the results. Please go back to the slides. You see the result here. I can't see it clearly from this area because of my sight. Let me go closer. Okay, the results are there. But basically, our own point is that the major point we want to talk about is that government should own these programs. Government have so much money. I work in the Ministry of Health and deployed to Primary Healthcare Development Agency. You know, the last speaker, they were saying Primary Healthcare Development Agency, that's our function. But if we don't have the support of government, how can we do massive research that will lead to elimination? So what do we do as parasitologists? We go for advocacy visit. We take it to the government and tell them that this problem, it cannot be solved except you allocate funds to this program. So that is basically the reason for this project. Like all of us as parasitologists, this must be part of this elimination program. Although it is overaching, but what can we do? You and I, let us go, pay advocacy visit to our stakeholders and let them know that the problem is there. It's affecting communities. The work I did in lymphatic filariasis, 3 persons in the family, they were already infected. Just imagine if they are in that community. And we know that even Anopheles transmits lymphatic filariasis. So let us, as parasitologists, take it to heart. It rests on us. It is possible. Although we might not be able to achieve 2030, but it is possible we can do something. Thank you very much.
Thank you very much. I'm excited this morning for seeing the quality of presentation. The presenter, you heed our information. We fill a form to tell you our perception about the hindering factors against NTD. It didn't tell us how the ranking of all how many people fill the form. How many people talked about this, so that we know which one is stronger against our program. Why did you hide it? All these things you are talking about lymphatic filariasis, they were not part of the questions we answered. Don't hide their answers. Give us the answers.
Thank you very much, sir. We just repeat the specific because of the abstract, because of presentation. We were limited to 12 slides.
How many people were surveyed?
Okay, we 227 participants.
How many of them said that advocates were responsible?
Over 90%. Sir.
You didn't show it.
It's on the
no. Okay. The kernel of the matter is that we are looking for good. This is where your argument should come. Of all the factors, the greatest, the parasitology field reform, we say that greatest majority or significant proportion of parasitologists say that advocacy is number one, or infrastructure, or whatever. Because so that when we go here into our programs, we look at that part of the hindering factor, it will help us. But you decided to hide it and start talking about the lymphatic filariasis, which you cannot see with your eyes. And you tell us about micro and macro.
Thank you very much, sir. Yeah.
Please, a round of clap for her. We call on the next presenter, abstract number 066. Abstract number 066.
Good morning, Mr. Chairman, my fellow professors and delegates. My name is Oaike Nigerian Sinimi. I'm here to present our research, which is on the activities of compounds from Hyptis suavolens and Momotica charantia against the etiological agent of African trypanosomiasis. Looking at our standing on the existing protocols and what our past presenters are presenting on neglected tropical diseases, we know that we're trying to see how we can curb neglected tropical disease. Even World Health Organization is targeting it for elimination 2030. But I am not going to just talk on the elimination. I'm trying to see how I can produce a drug that can be cost effective and available to the locals. We realize that most of the locals, since this neglected tropical disease, trypanosomiasis, affects locals, depends on plants for their treatment. So let's see how we can isolate compounds from these plants that the locals are making use of and treat their infection, and see if also what they are doing by using plants is actually effective, because they just feel it's effective based on the herbalist notion or the traditionalist notion. So let's see if scientists can consider these plants they make use of and test the fact that indeed scientifically these plants are effective. So let's go to our next slide. The plants were collected based on the report from locals and herbalists, and voucher numbers assigned to them, identified in the Department of Biological Sciences, stored also in the herbarium of the department. The extraction procedure was done using succinate analysis, and it was done with 3 solvents based on their polarity. We are looking at ethanol acetate, methanol, and chloroform. No, please go back to the, oh yes. Then the chloroform chromatography was used to isolate the compound. The thin layer chromatography was used to purify test the purity of the isolated compounds. The nuclear magnetic resonance gave us the structures of the compound. The liquid mass spectrophotochromatography gave us the mass of the compound. Then it was tested against 4 species, T. brucei, T. evansi, T. equipadum, and T. congolese. And also we also determined the toxicity of these compounds against human fibroblasts, foreskin fibroblast cell lines, because we don't want to produce something that will be effective against the parasite and also not good against human cell lines, which is what we're looking at. Please move on to the next. These are the compounds that were isolated from the plants. From Hyptis suavolens, we isolated tetrabutanol, carcillistic acid, suavenolic acid, suavenol, and also decided to go through and analyze the synthetic effect of suavenol and suavenolic acid, which is the 5th compound that was isolated from Hyptis suavolens. Then carbolizine D and momodicine 1 acetate were isolated from momodicine mimdical charantica. Please move on to the next slide. Although this class of compounds that were isolated, when we go research into it, we realized that they were all terpenes. And report has been given about the anti-malaria effect and anti-parasitic effect of these terpenes. The dihydrogenol butanols have been isolated by Ziegler, carboxylic acid by Mamachado, which it's actually a new compound based on our own work and previous research. The only work that has been carried out on it was Mamachado, which was on his GCMS that decided the compounds. It's not like if it was isolated. Swavenolic acid has also been previously isolated by Gavanagi and Parastic. Then also the synthetic effect, we looked at the research carried out by IAN in 2021, where they also isolated a synthetic effect and also tested it against the trypanosome parasite and see how effective it was. So we considered our own, which was Swavenol 70% and Swavenolic acid 30%. Carbonagen D was isolated by Chen and momodicine 1, which has been previously isolated, but ours was momodicine 1 acetate, which is the short form of momodicine 1 compound. And it's different based on this acetyl carbon, adenine carbon, and a metonic group that it has. Please go to the next. Based on this, our results and discussion will run concurrently. The compounds were all tested against the Trypanosoma brucei and T. congolese. We could see how effective SA, that's the synthetic compound, SSA, and Swavenol was. Then the other compounds were not effective. Move to the next slide. Since it was effective against Trypanosoma brucei, we decided to try it against other subspecies of Trypanosoma brucei, which is T. evansii and T. equipadum, and also these compounds were effective against them. Let's go to the next one. Okay, let's go to the next one. We also did the selective index, which is the ratio of the EC50 of the cell line, that's the human cell line against the parasitic cell line. And anything above 10 is effective. For the T. congolese, we can see that they were not effective with the ratio, the compounds giving us 6.8, 4.8. Why for the T. brucei, T. evansii, and T. equipadum, they were all effective above 10. Why some were above 100, which leads to the production of lead compound. Please move to the next slide. To obtain a lead compound, it must be above 10. That's a heat compound, but a lead compound must be above 100. So we can see that Swavenol was a heat compound for T. brucei, T. evansii, and a lead compound for T. equipadum. While the SSA was a lead compound against the trypanosomal species. Please go to the next slide. We're concluding with the fact that these compounds, Swavenol and SSA, as a synthetic compound, was effective against the trypanosomal species. That's the trypanosomes group, but not effective against T. congolese, which is under the biology of nanomonas, which is different from the Trypanosoma brucei species. And it should be considered considered for potent drug against this compound parasite. Also recommend that future work to be carried out to determine the mechanism of action of these compounds in this parasite, which is our next project. Well, thank you very much for listening.
Thank you, my fellow professor.
You're welcome.
While I appreciate your work, I have some questions. Number one, you did not show us whether you did phytochemical analysis. Did you do it?
No, we just go straight to the compound.
You should have done the phytochemical analysis, the qualitative and the quantitative. Number two, did you also take into consideration the antigenic variation in trypanosomes? So these plants, which specific blood forms did this plant attack?
From the locals, most times they were using it to treat trypanosome brucei.
So where did you collect the blood? Is it from man or from specific animal?
It was just based on information because the research was based on the reference strain of the parasite.
Okay. Lastly, did you do any toxicological work also? Because yes. I heard you said that you wanted to prevent the drugs, that particular plants, affecting man eventually. So did you determine the SC5 or SC50? Then did you also do any histopathological works to make us to want to see the effects of this particular plant if it is above a particular concentration?
The research was based on in vitro. We didn't do in vivo, but we're looking forward to that.
Join me to give her a round of applause, please. That she said, fellow professors, all of us here are professors. Some of them are under a prison, some of them have been confirmed, some of them are retired. Professors are professors.
Thank you, sir.
However, there are professors that are intellectual ordinary, but there are professors that are intellectual. I'm impressed, actually. The question my colleague asked, in drug development, you jump the first one, that phytochemical. Please, general comment. When you are coming here to present, ask your colleague with a paper. The essence of allowing you to present is for us to criticize it so that your paper will come better. So that when you go back to the lab, you may be need for you to adjust your methodology to fit in. Because if you don't correct you send it out, they will turn them back. Go back and look at the phytochemical properties of those.
The work was sent out.
No, consult him after.
Noted, sir.
That the stage you are is okay. You cannot go beyond this stage to toxicological work until we now have information on the phytochemical properties.
Noted, sir.
Then after this, you now go to toxicological work where you use the animal model. Thank you very much.
You're welcome, sir.
Thank you very much for that wonderful presentation. We call on abstract number 179. Abstract number 179. Not here. Abstract number 210. Presenter of abstract number 210. Let's clap for her.
Good morning, everyone. My name is Fatima Husseini Ashezi from Nasarawa State University, Kefi. This is a parasitological aspect of my PhD work at the Federal University of Lafia, Nasarawa State. I'm here to present a research on diversity of Plasmodium species in patients attending public health clinics in Nasarawa State, Nigeria. Malaria constitutes a large public health challenge in Nigeria, with an estimated 9 million cases and 194,000 fatalities in 2021 alone, according to the World Health Organization. Nigeria bears the highest malaria burden globally, representing almost 1/3 and 27% of the worldwide malaria load, and the risk of malaria transmission persists across the nation throughout the year. Statement of the problem. The main pillars of the World Global Health Organization is a technical strategy for malaria from 2016 to 2030, which is a prompt and accurate diagnosis followed by a quick and effective treatment of the malaria infection. Genetic diversity of malaria parasites can inform the intensity of transmission and poses a major threat to malaria control and elimination intervention. The study population consists of 1,200 consenting patients from the secondary healthcare facilities, that is General Hospital, Doma, Okona, and Nasarawa Igon, and 6 primary healthcare clinics. Nasarawa State is situated in the north-central Nigeria, having 3 senatorial districts, which are, so this study focused on 3 senatorial district of the state, which is Kokona from the west, Doma from the south, and Nasarawa Igon from the north. Next slide. 3 types of analysis are carried out, which is microscopy and rapid diagnostic tests, and the molecular analysis is yet to be carried out. 1.5 millimeters of blood samples were collected and stored in a solar refrigerator at the Nasarawa Igon local government General Hospital for the molecular analysis. And dry blood spots method has been done using a Watman filter paper in case there is a deterioration of the blood, whole blood collected. Next slide. A total of 1,200 patients were examined, and we had 750, that's 62.5% prevalence rate, using the microscopy as the gold standard, since the molecular aspect is yet to be carried out. So, Doma had 136 prevalence rate using 200 samples. Nasarawa Igon had 102, Kokona 127, with a total of 600 samples for the secondary health clinics. The primary health clinics had 34.5%, that is 133 in Doma, 127 in Nasarawa Igon, and 125 in Kokona. Next slide. According to age, the highest infected age range was 31 to 40, having a prevalence rate of 72.22, and 51 and above with the same rate. Next slide. Females were more infected than males, having a prevalence rate of 54.1 to the 45.8 prevalence rate of their male counterparts. Next slide. According to the occupation of the patient, civil servants and farmers were more infected than any other occupational group. Next. There are other factors that were examined, such as the seasonal variations, use of insecticide-treated nets, and the settlement of the patients, of which the limitation of the slides is only 12 we have here. So the result of the prevalence rate, which is 62.5%, corroborates with studies of Issa et al. And is higher than the study of Tadis 2023. The patients within the middle age group, that is 31 to 40 years, were most parasitized, as was said earlier. This result agrees with that of Iyabo et al. 2023, who observed that there is lack of variation in the prevalence of malaria infection and age. Okay. Next slide. Next slide. Next slide. Conclusion. The information on the prevalence of malaria prevalence in Nasarawa State shows that malaria remains a major public health concern despite pragmatic effort to control it. Thank you for listening.
Ido, University of Lagos. Please, the topic you are presenting said diversity of Plasmodium species. So I can't see that in your presentation. And then number two, just to note some correction. I think you need to improve on your slides because they're not really PowerPoints. It's more of a power word. And then prevalence is a rate. So you don't have to say prevalence rate, just say prevalence of this. Then when you are trying to discuss, you don't talk about the number because we won't be able to compare it. We need to talk about the percentages so that it can be relative, so that we can follow your presentation. So, but my concern is that I was looking for the diversity of Plasmodium species. That's what I'm really want to see in your, maybe you have not, you didn't get to that. Thank you.
We had 3 different species of the Plasmodium that are found in this research, which is the Plasmodium malaria, the Plasmodium falciparum, and the Plasmodium ovale. So because of the slides limitation, I was not able to capture some of the pictures. Okay.
Thanks for your presentation. Please, though I have not seen clearly, I have not noticed the statistics that you used in your analysis. So this one was more than this one was higher than this. What statistics were you used? So you indicate the statistics very well.
Question here. Thank you very much for your presentation. Very interesting. However, you had limitations. The first one is hospital-based study.
Okay.
So you cannot talk about sampling. There were the number of people, the cases that presented themselves at the health facility. And you cannot have control over the male, female, child, whatever age. It's whatever you saw that you analyzed. Yeah? So you should present it in that wise. And then telling us about 3 senatorial districts. You are more or less telling us that you cover the entire state. I didn't see the sampling that justify capture of the specimen from individuals from the 3
senatorial district that would ensure that each one was given equal footing. There's so many things I can say, but thanks for the effort.
Thank you so much.
Thank you for that wonderful presentation. We call on the next presenter, and that is abstract number 135. Abstract number 135. Not around.
Good morning, the chairman. Good morning, everyone. My name is Idon Esurumota. I'm here to present a study on the evaluation of the knockdown and insecticidal potentials of essential oils of Plectranthus and Bonicus and Erangium foetidum against Culex quinquefasciatus. Next slide. This is not the first letter. That's not the first slide, please. Okay. Mosquitoes are generally known to transmit various diseases such as malaria, lymphatic filariasis, and dengue. So there are different measures that it's used to control mosquito-borne diseases, such as synthetic insecticides. But there have been reported cases of insecticidal resistance, and therefore there is need to look for alternative measures to control these mosquitoes. Then Plectranthus and Bonicus and Erangium foetidum are herbs found throughout the tropics, including Africa. They are known for their endomedicinal and nutritional and therapeutic uses. Next slide. Study objective. This study was to evaluate the knockdown insecticidal efficacy of the essential oils of the leaf of Plectranthus and Bonicus and the aerial part of Erangium foetidum against Culex quinquefasciatus. The plant materials were collected from the medicinal garden of the Department of Pharmacognosy and Natural Medicine, Faculty of Pharmacy, University of Uyo. They were identified, authenticated, and voucher specimen deposited in the Department of Botany and Ecological Studies, University of Uyo. The plants were processed, and extractions were made. The extraction was done by hydrodistillation using Clavenger type apparatus. The test mosquito species were obtained from the insectary of the Department of Animal and Environmental Biology, University of Uyo. The larval stock were reared to adult, and the adult species were used for this experiment. Preparation of test oil. 1 ml of each oil were serially diluted using 15% to 80 at the diluent, and 5 concentrations were obtained. That is 31.25, 62.50, 125, 250, and 500 microliter per ml. And there was a control experiment which we used only 15% to 80 at the control experiment. The knockdown and insecticidal test was conducted using the procedures of WHO 2016, using the WHO insecticidal susceptibility tubes. The 20 mosquitoes each were exposed to each oil with a filter paper impregnated with different concentration of the oil and exposed to the oil. The knockdown experiment lasted for 30 minutes at an interval of 5 minutes, while the insecticidal experiment lasted for 1 hour at an interval of 10 minutes. Statistical analysis. Data obtained from this study was analyzed using a one-way analysis of variance and over to test to take if there was a significant difference in the potency of the oil, and probe it was used to determine the KD50 and LC50 values. Next slide. These are the results. The first table here shows the result of the knockdown effects of the different concentrations of P and Bonicus oil on colectic fatty. From the results here, the least concentration at 30 minutes, there was total knockdown observed with the least concentration at 30 minutes, while in the control experiment, there was no knockdown recorded at all. Next slide. Here is the ANOVA table showing the mean values of the mean knockdown values of colectic fatty exposed to different concentrations of P and Bonicus oil. Values along the same column with the same superscript were not significant, while means along the same column with different superscript were significant. Next slide. The table here shows the knockdown effect of different concentration of E-photidium oil on colectic fatty acids. Here, the least concentration after 30 minutes had only 10% knockdown. Meanwhile, the values in bracket are the percentage knockdown values. While at the highest concentration, there was complete knockdown after 30 minutes. While the control experiment, which the mosquitoes were only exposed to 1 meal of 15% to 80, recorded no knockdown throughout the experiment. Next slide. This is the table for the knockdown values, ANOVA table for the knockdown values of the different concentrations of the oil against a colectic fatty acids. Next slide. Insecticidal effect of different concentration of the oil of P and Bonicus on colectic fatty acids. Here again, the oil of P and Bonicus at the least concentration recorded 100% mortality on the insect. Next slide. Next slide. Okay. Next slide. Okay. This is the insecticidal effect of the different concentration of E-photidium on colectic fatty acids. We can see on the with the least E-photidium oil, the least 20% mortality against the insect, while at the highest concentration, 100% mortality was recorded, but the control experiment had no mortality throughout the experiment. Next slide. Next slide. Okay. Table 5 here shows the 30-minute KD50 values of P and Bonicus and E-photidium oil tested on colectic fatty acids. As you can see, the KD50 value for P and Bonicus was 12.793 microliter per mil, while for E-photidium was 334.73 microliter per mil, showing the higher potency of P and Bonicus oil against colectic fatty acids than E-photidium. Table 6 here shows the 60 minutes LC50 values of P and Bonicus and E-photidium oil tested against colectic fatty acids. Again, P and Bonicus oil had an LC50 value of 67.016 microliter per mil, while for E-photidium it was 643.663 microliter per mil. Again, showing the higher potency of P and Bonicus oil on colectic fatty acids than E-photidium. Next slide. Discussion. Concentration and time dependent. With the two oils, the effect of the oil on the insect were concentration and time dependent. That is, the higher the
Thank you for your presentation. Do you want to try it on Anopheles so that you can, we have issue with resistance?
Yes, we did. We did.
What happened? I'm just interested because these are my...
Okay. With Anopheles mosquitoes, a ranging Fortunium oil was more potent against Anopheles mosquitoes than Plectranthus and Bonicus oil. But that is in a different studies which have been published.
Thank you, Mr. Presenter. I'm interested in the chemistry of the oil, so as to know the demon that is performing these miracles.
Okay. Can I respond? Okay. The GCMS analysis was performed on the two oils and has been published. It's a different aspect of the work also, like I said.
Thank you very much for that presentation. A round of applause for our presenter. It's not easy. So is the presenter of abstract number 179. Is the presenter still available? Okay. So you are there. 179. Let me see. What's the title? I have here genetic mutation. Okay. It's today.
Good morning, professors, great parasitologists. I stand on the existing protocol this morning. Mine is just a findings on the genetic mutation in beta-tubulin of the oncovolvulus in ivermectin-treated regions in northwest Nigeria. It's no longer news. We know very well that onchocerciasis is the second common infectious disease that causes this blindness. And ivermectin offshore is the drug of choice. My introduction, I don't know. Ivermectin is a drug of choice. And over years, it has been a time of celebrating and the great successes that we have recorded in those areas that have compliance to ivermectin treatment. But I am here this morning to raise a red flag that it is not yet Uhuru. And we must look at the genetic aspects of the onchocerca volvulus and what is really happening over time. And so, this study came as the result of one of the trips with the transmission assessment survey carried out in Taraba State. I was part of the team that went, and In some of those areas where ivermectin were claimed to be distributed, I saw some striking issues that really brought up this study. People say they received the ivermectin, but yet there were positives, good significant positive samples that were recorded. And on that note, the study design was made, and eventually to ask the question, could it be compliance or what is really happening with the parasites? And that is why the study on the genetic mutation came up. We have study areas were being considered, ethical clearance were done. We used the normal parasitological method in the collection of those skin samples, and we used it, but it was now preserved in it was preserved in RNA later for further PCR analysis. Next slide. Now we see that in the molecular analysis, we had the DNA extraction using the Kite investigation kits. Sorry to say, after the storage and preservation, the samples were taken to University of Bremen in Germany, and where the molecular analysis were carried out. And we had the genomic DNA, the amplification were carried out, and the circular conditions given unto us, as we can see. Now we have the gel electrophoresis. Then when those amplicons were now purified, and the initial proposal was to use the refraction fragment length polymorphism that were used in studies carried out both in Cameroon and in Ghana. But the professor there tapped on my shoulder and said, you can do something different. Why not go bioinformatics and let's see the results that could come out of this? And that's what informed the core of this study. Now the next slide, please. We can see that 2 regions of the beta-tubulin genes were being considered, and were the target areas where we have the regions as being displayed. Primates were highlighted there. What happened in the bioinformatics, after having about 4 of those sequencing samples successfully done, we went into the bioinformatics, and the first thing, of course, is to blast by using the NCBI, that is the gene bank, and we have a very viable reference sequence. And then next was the nucleoside sequence. Sorry, let's still be there. We have the nucleoside sequence analysis, having to edit using the genus, and then bioedit as well, using to edit the sequences. Multiple alignments were carried out using the coding code aligner, commonly called the sequencer, and then the the amino acid sequence. And after achieving that, what we did was to say, let's actually know the protein level. And so we use the XPassive bioinformatic resources portal and convert the DNA sequence into the protein sequence. And having achieved that, the mutation analysis were carried out by the DNA Star Sequence Pro 16. Having done that, we now have to look at the results. The results, please now. The results shows these are the chromatogram within the beta-tubulin gene at this particular point in 1557 to 1857. We have the adenine as represented by A, since I will be discussing on that, not mentioning them, but having the A, C, G, and T. That is our normal ATGC. Now the next slide. in these results, what we were able to achieve is looking at the reference sequence. In looking at the reference sequence, we now run the alignment. And this is a codon con aligner, and it's used for point mutation. And it has the ability to show where there is that substitution mutation. And we can see clearly that there is a clear substitution at a particular nucleotide sequence point. And the first one we can see there is indicating the single nucleotide polymorphism position. Clearly indicated. We have the A at 1308, the B at position 118, the C and also 1188, and also we have the D at 1794. I must pause here to say this. There is an excitement, and when this analysis was carried out, because considering what was done in Ghana and also in Cameroon in Ghana by Ose et al. 2014, and also in Cameroon as well, we can see clearly that the exact nucleotide positions where they submitted were exact nucleotide position that we in this research have seen as well. It is a clear pointer that what they did in Cameroon in looking at the mutation of the parasite at that particular nucleotide position, the record also was repeated in Ghana. We carried it out in Nigeria, and it is giving us exact what they reported. But the good news also is there is this particular, oh no. Okay, go on. Let's get this last slide, please. The last slide. Now, here is it. Here is the summary of what we are trying to establish here. The nucleotide position is clear there. The reference codon, which is the transmission into protein and into the amino acid, was clearly indicated where we saw the mutant codon. Then transmission into the amino acid, we see that the amino acid here translated the initial, it is valine, and now we have the glycogen. It repeated in all the other positions being seen. The last slide, please, the last one. Now, in conclusion, there is obviously point mutation going on in some of those areas where, even though ivermectin were distributed, but there are some suboptimal treatment we are seeing. And I must say that this has strengthened the warning that genetic changes could occur or is already occurring in some of those parasites ivermectin treatment area. The take home is nationwide mapping in those hotspot areas. I call on molecular parasitologists to put heads together and let's really see what is happening in the parasite, and to also know if the mechanism of resistance is already in place. Thank you very much for listening.
Thank you very much for that excellent study. For me, I'm a hopeful person. And indeed, anyone that is alive must anchor hope. Yeah? All hope is not lost. The fact that we are finding genes that have mutated against the currently used ivermectin that has been in use for about 3 decades doesn't mean that scientists are not mindful of such a thing occurring. There's a drug, I'm sure you must have heard of moxidectin. Moxidectin actually is advocated for areas classified as hotspots. Yeah, it's also said to enable us cut across all these hotspots. So that instead of using twice a year treatment, in the Americas they use 4 times a year treatment before they were able to eliminate onchocerciasis. Excellent information, and we are glad that is also coming. You are concurring with what has been found elsewhere in the West African region. But the scientific world is mindful of this. Yeah? But I want us to remember, where did we start from? Onchocerciasis was causing blindness that was resulting in economic impact. Generations of people along the same line being blind, incapacitated to have livelihood. They cannot earn a penny. Go around now and go and look at the rate of blindness. It has tipped down. So the use of ivermectin has actually worked. We shouldn't lose hope. Yeah? And I'm not convinced that those people who didn't take the drug were having challenges with it. My chairman will speak to that, I hope. Yeah? There are efforts that are ongoing to find out what are the root causes for the so-called eukaryotic resistance mutation. We are also wondering, there's so many people who have not been compliant with taking the medicine. Sometimes they take the medicine, but they don't swallow it. Some swallow and spit out. Some distributors give to parents or members of the household, but it's thrown away. Yeah? So there's so many factors at play. The fly itself is also another issue. So there's a comprehensive effort right now within Nigeria. My chair will speak more to it. Yeah? To actually address all this from all angles. But thank you very much for your call.
Thank you.
I don't think I have anything to say that. The only thing I'm excited, all successful programs have based their programmatic actions on operational research. This one is operational research, and we take note of it.
Thank you, sir.
Because of differences in onchocercical volvulus of the savannah and forest, there may be need for you to also take samples from different ecological zones where we are treating to find out whether the same thing is happening in the rainforest or Guinea savanna. But scientists are aware of this. So there's an alternative microfilaricidal drug that we are now waiting for WHO to approve for us to use it at hotspot areas. But this is a good one. And the earlier you publish it, the better. Don't waste time. It's a novel. Thank you.
Thank you very much. And we have come to the end of the...
One more comment. And this one is not to the presenter. I congratulate you for the beautiful presentation. But to the implementers of NTD in Nigeria, I want to give a concern I have and urge you to up the quality of implementation. Dr. Mafe has mentioned some. Some of the distributors sit under the tree and fill the form and submit. They've gone to that village. They saw them coming, but they have been there treated, but nobody had taken the drugs. We found this in many villages in, where was that? Taraba, when we went for monitoring. I don't know how many of you were in the team. And our scientists, our distributors are not altogether sincere in the reports they give. They give report that they've treated, they haven't, particularly in the villages at the end of the road. That is the difficult to reach villages. So I'm telling those in the steering committee now, and I'm particularly talking to BEB, make sure that you pick all those hard to reach communities, put them out, and carry out special intervention to those communities. If you have to trek there, use donkey, use bicycle, make sure you get there and treat the people that should receive treatment, because there's a tendency of just let them be, and then you are doing game of numbers and putting out numbers for us to see we've distributed this number. It's not, if once you don't reach those people, there will be resurgence in future. Thank you.
Thank you very much. Thank you very much. We want to thank all the presenters of the first technical session. It has been a very exciting and revealing presentation. We have come to the end of the first technical session. We want to thank everybody while we move to the next stage of the conference. Thank you very much. Network, thank you very much.
TETFUND, my society. We welcome all members of our great society to the 48th annual conference holding at University of Uyo. We thank God for the journey mercies that we are all here, even though some people came in very late, some very early. But the bottom line is we all got here safe. And for that, we are very, very grateful. Please, I want to enjoin those seated at the back to please move forward, come, step down, and fill the seats on this side, please. We beg of you, so that we can have a more compact sitting arrangement, please. So those at the very back, please come down. We still have spaces here. The opening ceremony starts at noon. Shortly time from now, we'll have a tea break. We're expecting that to be served any time from now while waiting for the opening ceremony. In the interval, the technical team will play 2 videos to the audience here to see. The documentary of the NTD Day 2023, and then the documentary on the PPSN at 50th celebration last year at Owerri. So please enjoy the documentaries while tea is served, and by 12 noon, by 12, the opening ceremony shall commence in full earnest. Thank you. Music, please.
allows for understanding to what extent an organization has considered the voice of the people affected, and I think that would transform the whole quality of the way people affected by NTDs are participating. For example, from governance, program management, human resource aspects, finance, and also the external relations. I think it would translate or convert into perhaps into a kind of a benchmark or best practice, and then many more organizations could join in.
You cannot implement any program for NTD elimination without bringing on board persons who are affected by NTD to make their unique contribution. This tool seeks to bring on board persons who are affected by NTD from the position of being beneficiaries to part of the governance process of NTD elimination.
According to Everett Koop, healthcare is vital to all of us some of the time, but public health is vital to all of us all of the time. Calabar, a beautiful city in southern Nigeria, was where it all began in 1973. Formerly known as Nigerian Society for Parasitology, NSP, with limited membership then. It was primarily based in the 6 Nigerian universities that were in existence at that time. But in the year 2000, at the 24th Annual Conference hosted by Cross River State University of Technology under Professor Eka Braid as president, there was a name change to Parasitology and Public Health Society of Nigeria, PPSN, to make it all-encompassing for practitioners in public health and allied disciplines to be part of the society.
My name is Professor Eka Braid. I'm one of the founding members of the Nigerian Society for Parasitology, NSP, which was later renamed Parasitology and Public Health Society of Nigeria, PPSN. I hope that our society will make better impact on socio-economic development of our country, particularly in the area of disease control in future.
Flashback to 1973, a few universities then and postgraduate courses in zoology with opportunities for parasite biology research options at the doctoral level. Parasitology, human and veterinary, and entomology and public health were restricted to the discovery of new parasites and, in few cases, the description of the parasite fauna. Others that studied abroad had interest in parasites of animals and European interest. The founding of the society by graduates from such programs marked the beginning of the network and the reason for its research and capacity development base. Their agenda was basically to develop parasitology that responds to African needs and train others for research and health service.
Please, if this fell off from you, come and collect it. It's a very important document. If you are the owner, please come and collect it.
Clean water, looking for mosquitoes, outbreak of guinea worm, all those type of things, vaccination and the rest. Hookworm was very common. Ascaris was plenty. So, and these are problems that were not recognized, not taken to account. Unlike smallpox and some other viral infections. So a group felt that this common disease of children, river blindness, causing blindness, guinea worm, humiliating urine with blood, very, very common. So from there, a lot of people gathered together. Parasitology was becoming recognized in the university. Salawu did parasite of war gecko. I did parasite of Mabuya blandigi. Ashalu did that of frog. And it's like that in the University of Nigeria and Soka with Professor Anya at Ahmadu Bello University, University of Lagos, and University of Ibadan. So people just felt that, yes, this is a common problem. We can start promoting it nationally. Let's form an association ourselves. And that is how a group with Professor Awachi and Professor, I'm forgetting most of their names, Professor Gumba, Professor Anya, Chalono, Professor Chalono, yes, or Professor Kole, yes, coming together and started the association.
They were exemplary scholars who remained within the university system as lecturers and research fellows, as at that time, communication among them was simple and establishing contacts required very little formality. When new universities were established, pioneer members were appointed as lecturers to develop zoology, microbiology, veterinary and medical disciplines. This, however, marked an important phase in the network and the shaping of parasitology, entomology, and public health issues in training curriculum. A more robust and distinctly ambitious curriculum for the teaching of entomology and parasitology was introduced. The new curriculum responded to the agricultural revolution, water development, and its complementary need for pest and diseases management and control skills. The responsibility for addressing this challenge rested on these pioneers, and they tackled it at the capacity development stage. A radically new zoology curriculum was developed with domestic relevance in mind and generous component of entomology, parasitology, and diseases of public and veterinary health importance.
We moved from university to university to motivate and encourage young scientists to develop and show interest in science. What was common at that time is Nigerian Journal of Science. Because everything, chemistry, physics, parasitology, zoology, everything combined in that journal. Until later on, from there, parasitology established its own autonomy.
Before now, zoology graduates were perceived as fit only for employment in zoological gardens. The training curriculum that emerged responded to the Green Revolution and Health for All programs of the late 70s and early 80s. Subsequently, the demand for entomologists and parasitologists for the development of government programs in agriculture. Veterinary schools established departments of parasitology and medical microbiology, as well as entomology, to complement the training in some applied aspects of biology, including microbiology, biochemistry, and pharmacology. The network widened and the membership of the society became diverse.
People were very, very anxious to become members, and almost every year we had a conference. We used to have quite a number, joining the society newly. And it had been very, very interesting, because I know within 10 years the number A problem at one time was the way, some of the juniors, I will say, were not, presented themselves in the conferences, even though they were, okay, but they didn't seem to be very anxious at that particular time. That was just for some time anyway, because I know by the time I was president from 89 to 93, everybody, at least at that time, I know most of them were very, very interested in the union.
In background training, institutional affiliations, research interests, and locations within the country, the responsibilities of trained parasitologists and entomologists also diversified from teaching and direct intervention against diseases to managing programs with varying health outcome needs. From ophthalmology to nutrition, worm control to sexually transmitted diseases, water and sanitation, as well as performing various tasks, including consultancy to health and education communication. In addition to the universities, the National Veterinary Research Institute and the Nigerian Institute for Medical Research Biological Control Program, the Nigerian Institute for Trypanosomiasis and Onchocerciasis Research, and many other river basin development authorities recruited parasitologists in large numbers. The technical competence of these graduates made them the cream of recruiting services at the international level, with a large number managing programs at World Health Organization (WHO) and international development agencies. Only a very few sought employment in the bureaucratic arm of government until the early 1990s, when their visibility in the field led them to the policy arm of government. Multi-sectoral and multidisciplinary coinages were introduced into the health sector policy through these fresh entrants into the civil service, reflecting the environment in which parasitologists worked in the field. Worthy of note, social science disciplines and education became incorporated in the training of parasitologists to reflect their public health calling on graduation. The cream of those early promoters of the society are leaders in universities and research institutes as vice chancellors, directors, and managers of control programs at home and abroad, having successfully mentored two successive generations of disease control and health system research experts.
And I must say that today, the leadership, the drive, the commitment, the interest, the awareness, the promotion which the leadership
International, sir.
Or international. And so this is an annual.
Yes.
Good morning, very distinguished ladies and gentlemen, and welcome to the University of Uyo, a great citadel of learning, an institution where excellence meets with class and standard. I want to welcome you very specially. The auditorium you are in is known and addressed as the 1,000-seater auditorium. And so you are welcome to your 48th annual conference.
It's about the Parasitology in Public Health Society of Nigeria. Please, if you're not too busy with your hands, can you please celebrate yourself? Just clap. Thank you, and thanks so very much. Can we now celebrate our God, the giver of knowledge, the giver of wisdom, the one that is untiring, the untiring God. Please give me my voice. Lights. Okay, thanks so very much. Please, let's celebrate the untiring God, the one who has made it possible for you to travel all the way from Lagos, Abuja, Kano, Kaduna, all over Nigeria, and even across Nigeria. Can we celebrate some more? Yes, it's about God. And so thanks so very much. We have no doubt that this event will turn out a huge success. This is University of Uyo, and so we are not expecting anything less than excellence. And so on this note, may I please request that we please give this event the befitting look by requesting humbly that in a way that befits this event, and also for proper event coverage. Ushers, please help guests to allot the seats. While I'm still waiting for the LOC chairman or secretary, please, wherever you are, come to the platform. Please, I'm still waiting and no action is being taken. So the Vice Chancellor will not come in to see this kind of sitting arrangement. Please and please and please. Let's do it better. Thank you as you keep coming. Thank you very much. Distinguished professors, directors, heads of parastatals, members of the society, the national and international executives. Please keep coming. Okay, that will come up. I don't know if
You made the little things I do be like saying a big thing though. Your grace makes a difference, just to embarrass me, oh. I like it, oh, oh, oh. I like the way you delete me, oh, oh, oh. Lord, you made the little things I do be like saying a big thing though. Your grace makes a difference, just to embarrass me, oh. I like it, oh, oh. I like the way you delete me, oh, oh. Chinedumo, Chinedumo, Chinedumo. You are taking me higher, yeah. Jesus, my love is for you, Lord, Lord, Lord. Chinedumo, Chinedumo, Chinedumo. You are taking me higher, yeah. Jesus, my life is for your glory, your glory. You made the little things I do be like saying a big thing. Your grace makes a difference, just to embarrass me, oh. I like it, oh. I like the way you delete me, oh. Promotions everywhere, contracts everywhere, plenty money everywhere, 'cause you delete me every day. I say I like it, oh. I like the way you delete me, oh, 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 oh. Chinedumo, Chinedumo, Chinedumo. You are taking me higher, Jesus. My life is for your glory, your glory.
You make the little things I do feel like sin a big sin, no. Your grace makes a difference, just to embarrass me, oh. I like it, oh. I like the way you do me,
duri toro. Afomo duri toro. Ọmọ mi yọ ìsọ. Afomo duri toro. Afomo duri toro. Afomo duri toro. Ọmọ mi yọ ìsọ. Afomo duri toro. See the way you gave me. little baby. You watch over me. You know that carry me there, play. In a mail, in a song.
Please listen to this announcement. Professor Bamidele Akinsanya, Dr. Nancy Nodim, Dr. Philomena Ogbogu, and Dr. Peter Zawua. Please, your attention is needed at the registration desk. Professor Bamidele Akinsanya, Dr. Nancy Nodim, Dr. Philomena Ogbogu, and Dr. Peter Zawua. Please, let's meet there right away. Thank you.
Bagere buru vyanti
Prof. Hello, Prof. Professor, sir, please. So once again, very distinguished ladies and gentlemen, you are welcome. We'd like you to please sit tight while announcing the imminent presence of our dear Vice Chancellor. Please let's make welcome to the head table the International President, PPSN, Professor Sami Olufemi Samwobo. Please welcome him to the head table. Clap and clap and clap and clap till he gets here. Okay, thank you very much, sir. Permit me to invite first to this side of the head table, Board of Trustees, PPSN. My pleasure to distinguishably invite the chairperson, Professor Ekanem Igbe Bread. Please clap as she gets to the head table. Ushers, please help Madam. Keep clapping. Is that how to celebrate Professor? Thank you very much, Ma. Also to the head table, to invite Professor Chedu Felix Mafiana. Professor Chedu Mafiana, thank you very much, sir. Also to the head table, Dr. Margaret Aribiyoe Mafe. Dr. Margaret, thank you, Ma, to the head table. Also to the head table, Alaji Abubakar Boboye Jijiwa. So I got it right. Let's also welcome to the head table Professor Bertram E.B. Nwoke. Prof, you're welcome. Also to the head table, Professor Martins, S.O.I.C.N. Prof, welcome. To the head table also, my pleasure to bring up Professor Roland I.S. Agbede. Banjor. Thank you. Let's also welcome to the head table Professor Adamutogo. Okay, Tuku. Thank you very much, Ma. Also to the head table, Professor Chinyere Ugaga. Thank you very much. And so we recognize all the council of PP. Okay, please, thank you very much. Please, can we celebrate them one more time? Thank you very much. Also to this side of the head table, my pleasure to welcome Professor I.N.S. Dozier of Como University, Imo State. Thank you very much, sir. We celebrate you. Let me invite to the head table also Professor Latif Oladimeji Sani, Executive Director and CEO NSPRI Ilorin. You're welcome, Professor. Please clap for Prof. Also to the head table is, okay, I'm made to understand that Prof is one of the keynote speakers. Thank you very much, sir. Next is Dr. Henry Edegere, founder Ohamaime Consulting Abuja. Prof, please, wherever you are, you're welcome to the head table. Please celebrate the keynote speaker. Okay, my pleasure to invite to the head table the President, Zoological Society of Nigeria. Zoological, I beg your pardon. Zoological Society of Nigeria. Is he here? Thank you very much, sir. Okay, next to the head table is the country coordinator, Nigerian Leprosy Mission. The country coordinator, Nigerian Leprosy Mission. Thank you very much, sir. Okay. Okay, so the president directs that I recognize members of the council. We have here Dr. Mercy Ezekunala. Dr. Mercy, please, where are you? Thank you very much, Ma. If it sounds like your name is you, I'm calling, so forgive me. Thank you. Can we celebrate her? Angela.
Well, also to be recognized on the side of the council is Professor Angela Egwe. Sorry. Well, the typesetting is bad. It's very bad. So please, just bear with us. Professor Angela Ekwenife, I think that's how it should be. Also, Dr. Surakat, who is also the secretary. Dr. Labanji Surakat, the financial secretary, PPSN. Please stand up for recognition. Oh, thank you very much. We have the treasurer. Okay, I think she's going to introduce Professor Chinyere Kunife. Where is she? You are welcome. And the assistant secretary, Dr. Mercy Ezekunala, you are welcome. Thank you very much. We have the internal auditor, Professor Gloria Wokem. You are welcome. Right. Then we have publicity secretary, not here. That's Dr. Seni James Baker. I'm sure will join us sometime soon. We're expecting him. And of course, council is also made up of zonal coordinators from the 6 different zones. But I will not forget to mention the second calabash, the vice president to our president, Professor Gideon Amuga. Where's Prof? Professor Amuga, where are you? Okay, maybe he stepped out, he's been here. Then our secretary, Professor Antonio Dakul. Professor Dakul, all right. Please, all members of council should come to the middle here and sit the first 2 rows here, please. All members of council, please. We want to see your faces. Please, wherever you are, please come here, sit down. Then also on the council, we have the editor-in-chief, Professor O.M. Ekpo. Professor Ekpo, where are you? Thank you very much. You're welcome. The business manager, Professor Innocent Omalu. Professor Omalu is a very short man. I'm sure it will be difficult to see him in a crowd. He's very short. Right. Oh, Professor Amuga is here, the vice president. Please, they want to see you. Yeah, he's a very tall man on the opposite. So we have them balanced in council. Also, we have the editorial assistant, Dr. Izogi Adeyemi. Dr. Adeyemi, you are welcome. Then we have 6 zonal coordinators that anchor the 6 zones of PPSN across Nigeria. So we start from North Central. Professor Joela Malan, please, where are you? North Central. Professor Malan. Okay, he stepped out. I've seen him today. Maybe he stepped out. Then Northeast, we have Professor Rebecca Naftali Samuel. Yes, you're welcome, madam. Northwest, we have Professor Musa Dogara from the Northwest as zonal coordinator. Professor Dogara, you're on the wrong side of the party. Are you in APC or PDP? Or you are going to Labour? Which party? All right. So please, are you in APC, PDP, or Labour? APDP. All right. Your matter has been decided. So either join your party or you decamp. All right, you're welcome, zonal coordinator. Zonal coordinator for Southeast is none other than Professor Nkeruka Oji, the most beautiful woman in Southeast. They want to see you. They want to see that beauty. Please stand up. They say, where is she? They want to see you. Showcase what you have now. Organic. So at the South, the zonal coordinator is the elegant Mofe Pager. Please, she's not available in case you have ideas. Are you available? Sorry. I'm bringing up the rear. The zonal coordinator of the Southwest took apologies to be absent today because today coincides with his daughter's convocation ceremony. So he is not around. That is Dr. Babatunde Adewale. But he's represented here today by Professor Bamidele Akinsanya. Professor Akinsanya, please stand up. Acting Zonal Coordinator, Southwest. So, we have also amongst us, as introduced earlier, our distinguished Board of Trustees. These are the owners of PPSN. This is the think tank of PPSN. And, you know, when people talk of ancestors, we talk about them as those that are dead, our ancestors. PPSN is one of the very few fortunate organizations that have living ancestors. So these are living ancestors of PPSN. And they will live long, oh. And they will live long, oh. It's not loud enough. And they will live longer. Thank you very much. All right. Our special guests for today, the keynote speakers, and of course, I want to again, on the instruction of the president, reintroduce them to my society. The keynote speaker one, Professor Lateef Oladimeji Sani. You are welcome, sir. You are recognized again. Right. And Professor Sani is a Yoruba man. And pretty much culturally, we know that there are certain insignia of office that shows your status in society. Professor B.E.B. will agree with that very well. We are still going to break cola this morning before we start. It's a cultural requirement. So Professor Lateef Sani is a chief. He is a chief. And that is why you are seeing his hand bearing the Is he coming in now? No. Sorry, please. The Vice Chancellor of the host institution is around. We want to welcome him. So hold on, please.
Thank you very much. We shall continue from there. So very distinguished ladies and gentlemen, can we please rise as we receive the Vice Chancellor of the Great University of Uyo, hereby represented by the Deputy Vice Chancellor Academic Professor Antonia Essien, in company of the International President. Thank you very much. And so we shall remain standing to take a stanza of the Nigerian national anthem. Thereafter, we will sing the University of Uyo anthem. It's our ritual. Thanks so very much. Music department. University anthem before PPSN anthem.
African song.
and anthem. Do you have it, band? Okay. And so we shall please continue to stand as I please invite Professor Chinyere Ugaga for the opening prayer. Professor Ma.
Let us pray. In the name of the Father, and of the Son, and of the Holy Spirit. Our Father and our God, we come to you with thanksgiving. For this day, for this moment, thank you for the journey mercies granted to all of us. Thank you for the health of mind and body. Thank you for this conference because we know that it's going to be successful. To you be all the glory, honor, and adoration. Father, Lord, as we finish and we go back, take us back home safely and to meet all our people in safe hands. Glory and honor be to your holy name, we pray in Jesus' name. Amen.
Thank you very much. Can you may please take seats? Thank you so very much, Professor, for that wonderful and very apt prayer. Thank you so very much. The Vice Chancellor of our great university, here represented by the Deputy Vice Chancellor Academic, the International President PPSN, the keynote speakers, Board of Trustees, the Council members PPSN, visiting Vice Chancellors, the LOC, distinguished members of the society, members of the University of Uyo community, great Nigerian students, gentlemen of the praise, very distinguished ladies and gentlemen. It's my pleasure to welcome you to the University of Uyo, a great citadel of learning, an institution with the vision to be center of academic excellence anytime, any day. I welcome you to the 48th Parasitology in Public Health Society of Nigeria Conference. This event, which is aimed at giving knowledge, promises nothing than an overwhelming experience. And so once again, you are most welcome to this event. Please, before we progress, I'd like to point you to the activities of the day as contained on page 9 of the event brochure. If you are there, you can turn with me. And so before we get to the next item, which is welcome address by the LOC chairman, permit me to acknowledge in our midst the chief executive of this great institution. So refreshing to let you know that he is the first alumnus of the University of Uyo to sit at the apex. I'm talking about the chairman of the Distinguished Senate of the Federal University of Uyo, a veteran in the agric profession, a man of excellence and distinction. Professor Nyaudon Dayo is his name, our dear Vice Chancellor. Can we please celebrate him? Thank you for celebrating our dear Vice Chancellor. He is unavoidably absent due to other official assignments. But the VC is here ably represented by our amiable Deputy Vice Chancellor Academic, a very distinguished and academic icon, Professor of Professors, Teacher of Teachers, the Coordinator of Academic Matters, University of Uyo, and a veteran in the arts profession. She is of the action background. My pleasure to present to you the representative of the Vice Chancellor of the University of Uyo, Professor Antonia Essien. Please celebrate our dear DVC. Thank you very much, Prof. Thank you, and thanks so very much. We are happy to have you here. Please, for time constraints, I'd like to once again acknowledge other distinguished members of the head table through the National President, PPSN. While we sustain what we already did, can we celebrate them one more? And so I also distinguishably acknowledge once again the distinguished board members. Please, a round of applause to them. Thank you very much, sirs and ma'ams. Permit me to acknowledge the Honorable Commissioner of Education, Katsina State, ably and physically present here, Professor Abdullah Ahmed. Thank you very much, Prof. Thank you, and thanks so very much, sir. And on this note, our dear Vice Chancellor, very distinguished ladies and gentlemen, please can you celebrate your brother and sister? Greet that person, say me well to that person. Welcome the person on my behalf to Akwa Ibom State, the land of promise. So we celebrate you from Calabar. Do we have people from Cross River? Wave. You welcome the ancient city. We have people from Katsina? Wave. Kaduna State, please wave. Kano, we celebrate you. Sokoto, we celebrate you. Benue, Benin, Lagos, Abuja, Edo, Jigawa, Kogi, please help me count. We celebrate you. Celebrate, keep clapping. Thanks so very much. And of course, Akwa Ibom State. Emedio. Thank you so very much, distinguished conferees. We celebrate you. We love you. We welcome you with open arms. Thanks so very much. The Vice Chancellor, sir, very distinguished ladies and gentlemen, at this point, it is my pleasure to welcome behind the rostrum for the welcome address none other but the LOC Chairman, Professor Ken Okpara. Is he around? Please celebrate Professor. Oh, and so I recognize him with all his team. The LOC team, we celebrate you. You are wonderful. Thank you very much, Prof.
Thank you, my amiable MC. Permit me to stand on the already established protocol to give this welcome address. It is my great pleasure to welcome you all to the 48th Annual Conference of Parasitology and Public Health Society of Nigeria. This year's conference is hosted by three great institutions in Akwa Ibom State, namely the University of Uyo, known as UNIO, Akwa Ibom State University, known as AXU, and Federal University of Ikot, known as FUTIA. We are delighted to have such a distinguished gathering of academics, researchers, professionals from all around the country, united by a common goal of advancing knowledge in parasitology and public health. This year's theme, Stored Products and Public Health Concerns, is quite timely as it addresses critical challenges and opportunities in public health. In the next few days, we'll be listening to experts, engage in stimulating panel discussions, and witness cutting-edge research presentations. Our hope and belief is that through these exchanges, we will not only deepen our understanding, but spark new ideas that can drive the future of parasitology and public health forward. First and foremost, I would like to express my gratitude to the Vice Chancellor of the University of Uyo, Professor Ndayo Kwabio Dayo, Vice Chancellor of Akwa Ibom State University, Professor Nse USN, Vice Chancellor of Federal University of Technology, Abasi, Professor Leo Daniels, for co-hosting this 48th Annual Conference of this society. Your support and generosity made this event a resounding success. I also wish to appreciate our keynote speakers who graciously accepted our invitations to share their insights and expertise. Their contribution will be of tremendous benefit in our deliberations. Permit me to acknowledge our sponsors and partners whose support has been invaluable in making this event a success. Your commitment in fostering academic research and collaboration is greatly appreciated. It is with deep sadness and heartfelt sympathy that I extend my condolences on the passing of Pastor Patience Umeno, who was a promising pillar of support in the hosting of this conference. Our thoughts and prayers are with the family. To our participants, we hope that you will make this the best of this opportunity to network, collaborate, and exchange ideas with peers. I encourage you to engage actively, ask questions, explore possibilities for future research partnership. This is a unique forum where ideas can cross-pollinate and lead to breakthrough that benefit both academics and society at large. Ladies and gentlemen, organizing a conference of this magnitude requires months of hard work, meticulous planning, and collective efforts. I would like to recognize the incredible work of the local organizing committee, conference management committee, and our dedicated volunteers whose tireless commitment has made this event possible. Their attention to every detail, from logistics to hospitality, ensured that the conference plans were well executed. We are privileged to be gathered in Uyo a city renowned for its rich cultural heritage and vibrant academic community. I hope you take some time out to explore and enjoy all that it has. In conclusion, I wish you all productive and symmetric conference. May your discussions be fruitful. May your interactions be meaningful. And may your shared experiences enriching. Thank you once again. Welcome to the 48th Annual Conference of Personal and Public Health Society.
Please, can we celebrate Professor once more? The final word, may your stay be fruitful. Thanks so very much. Do not forget that it's about stored food products and public health concerns. That's the topic. Thanks so very much for that warm welcome note, Professor Ken Ukbara. At this point, the Vice Chancellor, sir, very distinguished members of the head table, distinguished audience, my pleasure to bring up for another address. This is going to be presented by none other than the international president, himself ably present, none other, Professor Sami Olufemi. Can we make welcome the international president? You didn't hear well. International President PPSN, as he comes behind the rostrum. You welcome, sir. And so as he comes, so I recognize Mrs. Unyame Ekpo Udia, Helen Keller International, and representative of the country director. Madam, please, where are you? Thank you, we celebrate you. Please, you can come to the front row.
PPSN. PPSN. My society. Thank you very much. It is my pleasure to welcome and acknowledge the Vice Chancellor, represented by the Deputy Vice Chancellor, and also the Vice Chancellors, represented of other hosting universities, Akwa Ibom State University, and Federal University of Technology, Ikot Abasi. I'm so delighted to have and welcome my brother, the Vice Chancellor of Kingsley Ozumba Mbadiwe University, Professor I.N.S. Dozie. Welcome. We recognize Professor Eka Bridge and the Chair BOT. We recognize other distinguished BOT members. We recognize council members, College of Fellows. We recognize Professor Latif Oladimeji Soni and Dr. Henry Degere, the keynote speakers. I want to appreciate and welcome Professor Alex Odaibu, the President of the Zoological Society of Nigeria, which is supposed to be the parent society of PPSN, but they are learning from PPSN. I also greet and recognize Dr. Sunday Udo and his team. Sunday Udo is the country director of Nigerian Leprosy Mission. We recognize Professor Mobolande Oniya, the chairman, Conference Management Committee, and his team, and also the chair and members of the local organizing committee. PPSN. If you are from North Central, please, can you rise? for recognition. You're welcome. If you are from Northeast, can you rise for recognition? You're welcome. If you are from Northwest, can you rise up for recognition? You're welcome. If you are from Southwest, can you rise up for recognition? If you are from Southeast, can you rise up for recognition? If you are from South-South, can you rise up for recognition? Mr. Vice Chancellor, you can see that PPSN is Nigeria. Thank you. It is pertinent to consider PPSN has established itself as a giant force to reckon with in the Committee of Global Scientific Organizations. It has undoubtedly made indelible marks on the sands of time, especially in global scientific research and mentorship that touch the very core of our existence. On my part, working with council members, we have been able to actualize the fundamental ideas of PPSN as a resourceful, fulfillment, prosperous society since the 47th annual conference at Owerri. We have listed some of our achievements, which are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17. To crown it all, we have a brand new BOT, and we have a brand new certificate of incorporation. On finances, I want to inform that when I started, we started with about 3 million. But the year under review, we had a gross income of 45,994,053 naira 79 kobo. Last year was about 28. And we hope that one day PPSN will hit the billion mark. The Financial Secretary will present a detailed analysis of the financial performance and strategic progress of PPSN. It is also to state that that financial report is in your brochure, and also the account has been well audited. The audited report is also in the account. The external auditor is here present. He will present his report at the AGBM. We lost some members, and above all, we gained more members in 2024. We moved our annual subscription revenue from 1,456,000 to 5,873 million naira. We also did our back revenue collection of backlog of annual dues. The Financial Secretary will explain in detail at the AGBM. We recognize and felicitate with our colleagues who we are promoted as professors. Professor Mandara Adamu Alaji of University of Abuja, Professor Anne Ogomaka of Imo State University, Professor Austin Amechi of Imo State University, Professor Dumpan of University of Jos, Professor Hilary Oko of Federal University of Oye Ekiti, Professor Ebenezer Mawulu of Niger Delta University,
Professor Anthony Dawet of University of Jos, Professor Signe Nziako of University of Port Harcourt, and the latest professor, Professor Pauline Umeanetu. If you are here, please can you rise up? All those professors, if you are here, rise up. Congratulations. In the year under review, some of our members got what mouth-watering grants. Some were also elevated to higher positions. To mention that Professor Monsuru Adeleke, alongside with Dr. Banji Surakat and others, they got a grant of $1.03 million. Professor Adeleke single-handedly also got another grant of $479,000. Banji, our financial secretary, got a grant of $76,790,000. If you convert this dollar denomination into naira, some of these monies are running into hundreds of millions of naira. So when you see them, some few years ago, they were looking like Omalu. But now they are looking highly robust. Banji just got in from Rwanda to come for this conference. One of our members, Dr. Sunday Siaku, was promoted as the executive director, reaching the last mile for African countries within site-saver coverage. And the Southeast Ppsn hosted a successful second annual symposium. We congratulate you. On this conference, the theme is stored food products and public health concern. The Nigerian government has thinking about food. And we now said, how does food relate to public health? So we are bringing in an expert in food. He looks young, or is young, but is a colossal. Professor Latif Sonny, I cannot describe him. We are colleagues, but I'm here. Sonny is here. Is presently the Executive Director and the Chief Executive Officer of Nigerian Stored Product Research Institute in Ilorin. His citation will speak more for him. During the Site Saver 70th anniversary, I ran into another living legend. And when we are compiling the 50th anniversary, we were looking at the history of Ppsn. His name repeated severally in the Ppsn history. When I had the opportunity to see him, I said, "Sir, we will use you for our next conference. Are you willing?" He wholeheartedly said yes, if that is what Ppsn wants. So we have in our midst Professor, I'll call him a professor, even though, because he's a professor of professors. When Professor Henry Degere started his academic career and retired, I was still a toddler. So, you're welcome, sir. Yes. At this conference, 3 partnering organizations and several others indicated an interest to partner with us. We want to appreciate Helen Keller International. They provided accommodation for our BOTs and our special invited guests, free of charge. So, Madam Helen Keller, please, thank you very much. We appreciate you. We also appreciate Site Savers. They sent him money And I know that the leprosy mission country director is listening. So before we end, you must put hand in your pocket and do something for us. This conference recorded 576 persons who registered as at 10th of September. This is unprecedented. Even when people begged that they wanted to register on site, we said no because we knew the problems would go through. I want to appreciate all of you and say that the next conference will be more greater and higher than this. I want to extend our gratitude to the Board of Trustees, Council, College of Fellows, Conference Management Committee, Local Organizing Committee, PPSN members, partners, and volunteers who have overtly and silently supported the success of this conference. I also appreciate the highly esteemed and internationally recognized speakers for accepting our invitation to share their knowledge with us. On behalf of PPSN, please accept our honest apologies should there be any inconveniences that may occur during or after the conference. When this conference was going on, the preparation, we lost somebody who, when we approached her, she said, we shouldn't worry. But unfortunately, God knows best. Can we please rise up for a minute silence in the honor of Our Excellency, late Pastor Patience Umo Enom.
May the soul of amiable Pastor Mrs. Patience Umo rest in the peace of Christ.
Please, can we celebrate the international president for that wonderful address? Thanks so very much. It doesn't get better than that. The international president, PPSN, my society. I like food. I don't know about you. You like food? So we are together. Thanks so very much, the President. Dear Vice Chancellor, Board of Trustees, distinguished audience, without much ado, we are getting to the next item, and that's up next is to receive a welcome, is it an address, a speech by the chief host, talking about our dear Vice Chancellor, the 8th substantive, ably represented by our very own Deputy Vice Chancellor Academics. Please, can we make welcome the VC as he comes forward to present his address. Please keep clapping till the Vice Chancellor comes behind the rostrum. Celebrate. Thank you very much, Prof.
PPSN, my society. Yes. It is my pleasure it is my pleasure to be here this afternoon on behalf of our amiable Vice Chancellor of the University of Uyo, Professor Nyaudo Ndayo, to very heartily welcome all of you to this 48th PPSN annual conference. I do know that protocol has been established and very well done for that matter. But permit me to most respectfully recognize the international presidents of PPSN, Professor Sami Olufemi Sambowabu. Prof, you are welcome. And permit me through him to recognize all the members of this great society of Nigeria and beyond. Let me also, in a very special way, welcome and recognize the keynote speakers, because through them, we are going to learn a lot this afternoon. So I welcome Professor Lateef Sane and Dr. Henry Edegere. So you are all welcome. I want to welcome everybody seated on this side of the table. People call it high table, but I really think it's a service table because each of them has something to do of service. So you are all welcome. We are all colleagues out to do for us this afternoon. So I welcome all of you. Let me welcome all of you that have traveled from far and near. We know what it means to travel in Nigeria today. Those of you that have had to come by air, you know that it has touched your pocket, isn't it? So we are very grateful that you have come. I want to do a very important recognition. So very important for that matter. It is not easy to move vice chancellors around. And I'm so thrilled to see that a vice chancellor has traveled all the way from Imo State, Professor Ikechukwu N.S. Dozie. Prof, I think you need to stand for a very serious round of applause. Mr. National President, I don't know how you managed to bring out a vice chancellor. I think you must be great. Even if it's your member, it's not easy to move them around. As a deputy vice chancellor academy, I understand what it is. So, Prof, we truly appreciate your presence here. Thank you very much, Prof, for coming. Let me also recognize and welcome the Board of Trustees, members of the Board of Trustees, even though they are not here. Some of them may not be here. I also want to very heartily welcome the co-hosts of this conference. First of all, my own Vice Chancellor, Professor Njaudo Ndayo. I'm glad that it's one of the co-hosts. I also want to appreciate the Vice Chancellor of Akwa Ibom State University, Professor Udo Essien, for accepting to be one of the key hosts. And also the Vice Chancellor of the Federal University of Technology, Ikot Abasi, Professor Leo Daniel, for co-hosting this conference. We are very happy and grateful that all of you are here in this land of hospitality. And I hope after the conference you stay back and enjoy a bit of Akwa Ibom State. Don't go back without enjoying fisherman soup, afang soup, fresh fish, and cool off a bit in some corners that are good. Thank you very much for coming. I am really very thrilled, and rightly so, to see that you have chosen a very important theme for this year's conference: stored food products and public health concerns. This is so very important because in the situation we find ourselves in our country today, if things are not properly stored, especially food, we know that it can wipe off even all of us seated here. So I'm happy that you have chosen this theme at this time in the history of our country, where this very important aspect of our life need to be considered because of its effects on public health. Some years ago, I wasn't a deputy vice chancellor academic. I went to make some purchases of some produced food item, and they told me to wait outside that it would be brought to me. When I looked at the environment, I pleaded and insisted that I would like to go in, and what I saw there was terrible. So choosing this theme is very good. Mr. President, thank you very much, because you are really going to serve our nation. I want to thank all of you also for the key achievements that you have made as a body. So very wonderful. These 6 key achievements is really going to help us as a country. It's going to help us as an individual. It's going to help everyone, because we cannot continue to let things be as usual. Things must change. So I'm very grateful that you have reached the extent of international engagement and visibility of locally trained Nigerian health system scientists in the control of disease, the promotion of the credibility of Nigerian educational system. I think you deserve a hand of applause. Thank you. You have done so very well. And also engaging in developing an agenda for dialogue between researchers and bureaucrats, and developing a working relationship between government and intellectuals for disease control in Nigeria. I can see that all that we have achieved as a body is wonderful. So once again, Mr. President, I want to say thank you very much. I mean, you couldn't have done less having vice chancellors and great academics in this society. Thank you very much. Then, on behalf of the Vice Chancellor, once again, I want to very heartily welcome all of you to this meeting. He would have been here because he got the invitation, but you know how it is. Professor Ikechukwu will tell you how it is with Vice Chancellors. He's not able to be here and has asked me to really welcome all of you and to wish you very successful deliberation throughout the conference. I will be glad to have the conference proceedings to help us in our academic endeavors. So once again, welcome, welcome, and welcome.
Do better than that for our dear Vice Chancellor.
The Vice Chancellor, ma'am, I want to inform you that on this side of the table are the BOTs, and we have Vice Chancellor, Vice Chancellor, Vice Chancellor, Vice Chancellor, Vice Chancellor. We have people who have been Vice Chancellor 3 times, 2 times, all kinds of things. So they are all here. People who have been up there. Yes.
Wow, this is emeritus. So we celebrate them. Thanks so very much, Sirs and Mice. Thank you. That was a wonderful welcome note by our dear Vice Chancellor through his amiable representative, the Deputy Vice Chancellor Academic of this great institution. And the final note was you're welcome, welcome, and welcome. And so on this note, our dear Vice Chancellor, distinguished BOT, here present council members, the national or international presidents, distinguished audience, we've come to a another very important item, and that's goodwill messages. So we have the goodwill messengers in the house, and the very first to come behind the rostrum, 30 seconds? 60 seconds. My pleasure to bring up, is it the President of Nigerian Academy of Science. Is he around? Please let's make welcome behind the rostrum. Wow. Keep clapping. Celebrate Professor. Professor Ikanem Ikpe. You're welcome, Ma. Thank you very much, Ma.
Thank you very much. The chairman of the occasion, Deputy Vice Chancellor, Professor Anthony Essien. Yes, Essien, I hope I got it right. Representing the Vice Chancellor, University of Uyo, Professor Sam Wobia. Here they call you International President. So that's the new name now. The President of PPSN and the hierarchy of PPSN. Distinguished ladies and gentlemen, permit me to adopt the already well laid out protocol. Let me not stand on it or lean on it so that it won't collapse. So, it's a pleasure for me to be here today at this conference, 48th conference. The theme is quite apt, and I'm happy that Professor Sani is here to give us an insight into what is there in stored products for PPSN. I'll also appreciate Professor Sani that the Nigerian Academy of Science was your first tenant in Lagos, in your building. But now we are moving somewhere. We've moved somewhere else, Unilag, and still moving. I actually have a smile in my mind today because the growth of the society over the years is very, very fulfilling, and that is why I smile both externally and in my heart. As one of the founders of this society, let me take you back memory lane a little bit. And when you see that anything applies to you, you know about it, just raise your hand. In 1975, how many were born then? In 1975, a few parasitologists from different universities in Nigeria, at that time there were 6 universities or 7, attended a conference of the Science Association of Nigeria, SAN, in the University of Calabar. These parasitologists held a side meeting, a casual side meeting, and decided to form the Nigerian Society for Parasitology, Nigerian Society for Parasitology, to address the huge negative impact parasites had on health of Nigerians. That was the inaugural meeting of the society. And at that time, we were thinking of having members from various disciplines. That is why we named it Nigerian Society for Parasitology, not of Parasitology. And I think I know one social scientist who was a member, but I think we've lost him. Maybe we don't have him on our list. At that inaugural meeting where Professor UK Eyenigi, who spearheaded this, we had Professor Edet Okun, he's late now. We had Professor E.O. Ogumba, also late. We have Professor M.O.E. Iwala. I saw him at the conference last year, still alive and well in Owerri. Professor J.P. Fabiyi, whose book we will launch during this conference, and me, an assistant lecturer then from UAN, University of Nigeria, Nsukka. Others might have been at that meeting, but I can't remember their names, but I remember that Professor M.N. Muhammad, who was a one-time Vice Chancellor of University of Calabar, was an early member. Professor M.G. Ogbe, the Unilag people will know him. He was an early member. Professor R.I.S. Agbede was an early member. And Professor Ndu Umeche, don't know where he is, must have retired, was an early member. The next meeting, or let me call it a conference, was held in Zaria in 1979. How many of you were there? No. And then from that conference, The conference moved to Lagos, 1980. Calabar, 1981. I know somebody who was there. He ate so much Edika Icon, he almost missed his journey back. We were looking for him. 1982, Jos. Great. 1985, Enugu. 1986, Ibadan. 87, Ilorin. 89, Vom. 1990, Kano. Went to Kano. 1991, Ile-Ife. 93, Calabar again. 95, Jos. 96, Makurdi. 97, Bauchi. 98, Benin. 99, Port Harcourt. 2000, Calabar. 2001, Yola. Who were people there? Yeah, okay, a few. And then 2002, Abuja. 2003, Owerri. 2004, Lagos. 2006, Jos. 2008, Calabar. 2009, Benin. And 2015, Lafia. That is where I lost count. I hosted that meeting, that conference, as a Vice Chancellor of Federal University, Lafia. But from then on, I couldn't now continue to list, but I'll do it after this meeting, because I know I have attended some more conferences. I remember taking my undergraduate and graduate students to a number of these conferences, and with limited funds then. If I tell you what salary was then, you'll be surprised. Paying for 1 or 2 hotel rooms for all of them to share. Some of them are here today. They are big professors, they are vice chancellors, deputy provosts. They are here in this hall. And DGs of agencies. Some are in this hall today. Yesterday at the council meeting, Professor Tubanjo also took us back memory lane when she narrated how Professor Ogumba, late Professor Ogumba, held meetings with a few parasitologists in the University of Ibadan and facilitated their membership of NSP. I think those meetings were in Professor Ogumba's office as the Dean of Postgraduates. So there were few, maybe 6. Similar efforts by founding members of NSP have yielded results. And today, there are close to or more than 600 members of PPSN. Former Nigerian. 1,194. Wow. That is from a group of about 6 people going through different cities, holding conferences, changing the name of Society for Parasitology to PPSN. You will agree with me that this has been a giant step from then to today. I congratulate all the executive councils, the different councils that took us through the journey. I also congratulate, and most importantly, I congratulate the present ESCO under the leadership of Professor Sam Wobo, the international president, for all the recent innovations in the society. Done with history, let me bring you greetings from all 300 fellows of the Nigerian Academy of Science. The Academy is the foremost independent scientific body in Nigeria. In fact, we consider it to be the Supreme Court of Science in Nigeria. It is dedicated to the development and advancement of science, technology, and innovation in Nigeria. The Academy was founded in 1977 as a national non-for-profit organization with membership covering all fields of science, including medicine and engineering. The Academy is Nigeria's national representative in many international bodies. Such bodies include the International Science Council, which is the umbrella body for all science associations and unions globally. The Inter-Academy Partnership, IAP, which is the umbrella body for all national science academies globally. The Academy is also a founding member of the Network of African Science Academies, NASAC, and the West African National Academies of Science, WANAS, which was recently formed with the help of ECOWAS recently. Since inception, NAS has been working smart to achieve our vision of an improved quality of life for the Nigerian society. I think our society here is also on that track of trying to improve the quality of life for Nigerian society through the promotion and application of sound science and technology. We do this through our mission of strengthening the nation's ability to deliver the fruits of science to society by the acquisition, growth, and dissemination of sound scientific knowledge and the facilitation of its use in solving major national problems. Scientifically and specifically, our mandate is to assist government in achieving solutions to major national problems that can be solved by the application of science, technology, and innovation. So we provide advice on specific problems of scientific or technological nature presented to us by government and its agencies, civil societies, as well as private organizations. We bring to the attention of the government and its agencies problems of national interest that science and technology can help to solve. And we establish and maintain the highest standard of scientific endeavor and achievement in Nigeria. Through our publication, the journal supported by government and TETFUND, we organize conferences, symposia, and webinars. We recognize as outstanding contributions to science in Nigeria. We have the NAS Gold Prize, and we have the Media Prize for Science Reporting. We have developed collaboration network with other academies, and we also have conducted activities which PPSN members have attended, particularly the webinars. We have had a track record of successful partnership with government at all levels and other stakeholders in addressing issues related to socio-economic development in Nigeria. Permit me to mention a few, and many of you must have participated in this. The Academy has participated in reviewing policy documents for Federal Ministry of Science, Technology and Innovation, as well as Ministry of Health. The Academy was invited to assist in reviewing national planning documents and advice on science-related interventions required urgently for national development. It is on record that our Academy assisted our country in the containment of COVID-19 and collaborated with our counterparts in West Africa to exchange expert knowledge on best practices during the pandemic. With respect to education, the Academy, in collaboration with JAMB, the Ministry of Education, the Nigerian Academy of Letters, the Nigerian Young Academy, and other state actors, we are implementing a project on STEAM education in 6 states. We intend to seek for more funding to cover the entire Nigeria. But what we have done in 6 states was fully funded by JAMB. We have concluded phase 1 of a project aimed at enhancing research capacity in our institutions. And we also are carrying out an inter-country project on addressing predatory academic practices. The Academy recently conducted the investiture of the President of Nigeria, His Excellency President Bola Ahmed Tinubu, as Grand Patron of Science in Nigeria, to drive the use of science as a mainstay for national development. When we went to Mr. President, we didn't ask him for money, we didn't ask him for any support, we just asked him to conclude the setting up of a national research foundation for all researchers in Nigeria, and also provide national research funding for research conducted in Nigeria. We are building and setting up a library and science museum on a piece of land in Abuja, given to the Academy by federal government in 2015. The library and science museum complex will soon be commissioned for use by researchers as well as students of primary, secondary, and tertiary institutions. We plan to also have a conference center, an administrative block, and some residential facilities on the property. The museum and library complex was funded single-handedly by a Nigerian philanthropist, by somebody who liked what we were doing. And I won't mention his name, but when we commission it in January, you will see him commissioning it. At this point, and for want of time, let me invite participants to visit our website, the website of the Nigerian Academy of Science, for more information on the Academy. The Nigerian Academy of Science is open to collaborations and consultation in ongoing innovative national projects. We believe that for current national problems to be solved, we need to have research feeding policy and practice. Research must be for development and not only for climbing the academic ladder. Research must solve national problems, and there should be a healthy collaboration between researchers, government, and industry in a quadruple helix manner. There should be collaboration also across disciplines, and that is why our Academy NAS is collaborating strongly with the Nigerian Academy of Letters and a number of other organizations on some national problems. In closing, let me drop a suggestion for PPSN. International President, I hope you are listening. Members of NSP, now PPSN, have participated in individual capacities in various disease control and eradication programs. But PPSN as a body has not been visible in this respect. So I suggest that PPSN should each year pick a health problem and collectively address some aspects of the problem. There will be a great impact if each year all zonal chapters of PPSN carry out education, that is behavior change intervention, on a specific problem. The diseases in the NTD family seem to me to be where to start. And within the NTD family, the neglected tropical disease family, there are neglected diseases of the neglected tropical disease family. There are some diseases there which nobody talks about. And we are going from where we were to where. That's where it starts. So at this point, let me wish the participants at this summit a pleasant experience at this event. And I wish to thank you for your keen attention.
Please Please, can we give a hand to the BOT? Very much. Please, we will pause there concerning the goodwill messages. We shall continue after this item through the permission of the Vice Chancellor and the International President, directed to bring up Zoological Dance Troupe, Department of Zoology, Akwa Ibom State University. Happy viewing. Are you ready? Your time starts now, sir. 60 seconds. This simply tells you that Akwa Ibom yaya. Beautiful dancers, students of the Department of Zoology, Akwa Ibom State University, flagging the beautiful colors of Akwa Ibom State, orange, white, and green. The beautiful dance steps. You can only find this in Akwa Ibom. Ladies and gentlemen, can we please give it up for this wonderful dancers? Beautiful. Thank you. Thank you. Thank you. Beautiful. Can we please celebrate them? Let's give it up. You can dance if you wish. Aha! Beautiful presentation by Akwa Ibom State Young Maidens from the university, Akwa Ibom University. Thank you, beautiful students. Thank you. Thank you for this warm reception. Thank you. They're telling you bye. Until next time, bye. Bye. Bye, the zoological dance group. Thank you and thank you. Thank you. Thank you. Please, can we celebrate them as they take exits? Beautiful. Can only see this one in Akwa Ibom. Aha! Asianu Boipa. Beautiful. 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 Excellent presentation by the Akwa Ibom State University students, Department of Zoology. Ladies and gentlemen, that's a wonderful one there. Packaged by the acting HOD, Department of Zoology, AXU, Dr. Imekan Akpan. Can you please rise and take a bow? Thank you very much. We celebrate you. Thank you and thanks so very much. The international presidents, a very distinguished audience due to other official engagement on the part of the Vice Chancellor. I please request that members of the head table please do a photo session as the VC will attend to other functions. Then we will continue from there. Thank you very much, sir. So I respectfully invite BOT. Please, we are going to stand here. We are standing here. The media guys, please come. Yes. Okay. Hello, Chairman. Yes. Prof, please come and join now. We will have more of this session after the closing ceremony. So while that is going on, let me put the next goodwill messenger, representative of Zoological Society of Nigeria, will bring up the next goodwill message. Thank you very much, Adi Vice Chancellor. Please, representative of Zoological Society, of Nigeria, please come behind the rostrum as you present your goodwill message. Is there around? Okay, not yet here. Is here. Okay, sir. Thank you, sir.
I don't know. The chairman, board of trustees, Professor Ekanem Breed, other members of board of trustees, the international president, and members of council, they are present. It gives me great pleasure to stand before you this afternoon to present a goodwill message from the Zoological Society of Nigeria. I'll bring you greetings from the council and members of the Zoological Society of Nigeria. The society will be 22 years in November, and we have had 17 years of experience in organizing conferences. However, I stand here on behalf of the Council of the Zoological Society of Nigeria to salute and congratulate the president and members of PPSN, the chairman and members of BOT, and council member on your 48 years experience in delivering international conferences, workshops, and symposiums for distinguished and renowned scientists and budding researchers. Each conference is different with its own unique deliverables. This achievement is powered by the ability of the conference management committee, coupled with the amazing imagination of the executives. The Zoological Society of Nigeria, on this note, is proposing to tap into these tested conference management skills for our subsequent conferences. Considering the theme of this conference and the diversity of titles in the book of abstracts, the 48th annual conference promises to be a scientifically rewarding and refreshing experience. And I can only wish that we all tap into this year's conference deliverables. The Zoological Society of Nigeria is open to all. Like the international president said earlier, is supposed to be the mother society. Apparently, each and every one of us here should be members of the Zoological Society of Nigeria. Joining is so easy. Just hook up onto our website, and you have a very simple form to fill, and then you become a member. So I hope to see each and every one of you in our next conference as we look forward to the 2025 conference that will be taking place in University of Ibadan, Nigeria. Here again, I wish you all a successful deliberations and a very nice conference. Long live PPSN, long live ZSN, long live Federal Republic of Nigeria. Thank you.
Thank you very much, sir. Professor Alex Odaibo, President, Zoological Society of Nigeria. I'd like to call the next for the goodwill message, the Vice Chancellor of Kingsley Ozumba, Mbadu University, Professor INS Dozie FPPSN. Professor.
Thank you. Yeah, the chair, the VC in absentia, the chairperson board of trustees and members of the board of trustees, the keynote speaker, other members of the high table. I want to, on behalf of the Senate, management, staff, and students of Keum Badwe University, that's Nigeria's 42nd State University, convey very warm felicitations to our great society, PPSN, at the 48th outing. When we had our anniversary last year, the Golden Jubilee anniversary and the 47th meeting, we all look forward to this meeting today. So I'm delighted we're here. I want to commend the organizers of the 48th meeting for a very successful meeting. I also want to commend our great society for gradually each year fulfilling the mandates for which this great society was established. So I think this is the spirit and we need to continue to walk in that direction. So once again, I convey warm greetings from my staff and students at the Keum Badwe University and wish all of us a very successful conference. Thank you very much and God bless.
Thank you, Vice Chancellor, sir, for the good message, short and precise. Thank you, sir. Next, I'd want to invite the country director of the Leprosy Foundation, Dr. Sunday Udo, for his goodwill message. Thank you very much.
Thank you. Obviously, I'm not Dr. Sunday Udo, but I'm here to echo his voice. He's not supposed to be here because he's been a bit under the weather, but because of the importance of this meeting, he had also ensured that he come here and just show himself as well. Sir. So when the international president talked about funding, that's the person with the deep pocket. All right. I would like to just ride upon the wings of the chairperson of the board of PPSN, Professor Braid, who had said that she will not stand on the existing protocol because if she did, it may collapse. And rather, she chose to adopt the existing protocol. So I will not adopt. I will want to ride on her wings because it makes it easier. And the other reason why I will also ride on her wings is because my boss and I are here today because of the warm relationship that we've had with her. She was one time board of trustee member of the Leprosy Mission Nigeria and also currently a member of the International Board of the Leprosy Mission International. So thank you very much, Ma, for inviting us. So I would like to ride on your wings and say all protocols duly observed. For us, this goodwill message, it's a two-edged sword. One, it's about we wanting to travel with you as an organization, as an association. The second one is before we can travel with you, you need to know us. Okay? And so I'll just use the next few minutes and just about 9 slides to just briefly introduce who we are and then to also see how our journey actually play out. My name is Pius Ogbusunde. I'm the head of programs and operations for the Leprosy Mission Nigeria. Now, the Leprosy Mission is an international Christian charity that is strictly, that was founded in the year 1874. And our main focus is bringing healing and restoration to people affected by leprosy. Now, we have had the opportunity and the privilege to listen to some of the paper presentation here. And as the chairperson of the board mentioned, that there are certain diseases that are neglected among the neglected entities. And leprosy is one of such. So the Leprosy Mission currently, as a global organization, we've been working very closely with various governments and ministries of health to tackle the scourge of leprosy. And this year, hopefully next month, in India, as a global organization, we'll be marking 150 years as a leprosy-focused organization. Now, in Nigeria specifically, the Leprosy Mission began to work since the 1920s. And ironically, one of the very first places we started was here in Akwa Ibom, at Ibom, where we still currently work and support the Akwa Ibom Church. We were officially invited in 1989 when leprosy and TB became a public health concern. The federal government invited the Leprosy Mission along with 3 other anti-leprosy organizations to come support the government to tackle the concern of leprosy. Officially, as an indigenous organization, with our own local autonomy, the Leprosy Mission became registered in 2001 and is currently being led by a 7-person board of trustees. So we do not do this work alone. We collaborate with various partners, with the government, other NGOs and all that, and especially with universities. Our vision really is we want to see an inclusive society where leprosy is defeated and where people affected by leprosy and other disabilities live life in all its fullness. And for us to do that, we seek to bring about transformation, break the chains of leprosy, and empower people who are affected to attain dignity and life in all its fullness. As an organization, we have key thematic areas that we focus on. And I think that will interest all of us. We work in various thematic areas. We work in leprosy. We are addressing the concerns of leprosy, also that of NTDs. We also run interventions for disabilities, issues of dermatology, mental health, and happy World Mental Health Day to all of us as well. And so we also focus on issues of gender, research, and many other things. For us, we run projects that address all these various areas of concern. So for leprosy, for example, we are currently running 5 projects focused on 11 states across the country. For disability, for example, we are working with 17 partner organizations to address the challenges of leprosy of young children who are affected with disabilities across the country. And we are running 4 projects across 4 states to address the issues of mental health. That's just an example of the pool of some of the projects that we do. And for research, it will also interest you. We are currently running 3 research projects. And one key one is we are running a project which we call, on the use of local honey in the treatment of leprosy ulcers. So it's a key research that is ongoing, and we are doing that with University of Birmingham in the UK. Now, let's quickly just look briefly at the leprosy situation in Nigeria. Is leprosy still a concern? And the answer is yes, because Nigeria ranks 10th among the 23 global leprosy endemic countries in the world. In 2023, for example, we recorded 2,425 new leprosy cases were found across the various states in Nigeria. Now, there are 2 indicators that tells us if leprosy is still a public health concern. One is when you still find children, being found with leprosy. And children here means anyone less than 14 years. Because it takes a long time in terms of the incubation period for leprosy to show. But yet when we find children, it means leprosy is still very active in our community. The second indicator is when the people you find them with physical deformity. it means they were found late. And so for leprosy, if you do not find it, if you do not look for it, you will not find it. And so this says to us there is still work to be done. I know this is a bit tiny, but this gives you the spread across the states of the new cases found in 2023. You will see the spike in some of those states like Zamfara, Niger, Kebbi. Now these are the states, some of the states where we work. Now the reason for the high number that you find is because we currently have active skin camps going on to search for these cases of leprosy. Now, these are just some pictures of the cases we just found. The pictures to my left are the cases we found in Q2. The pictures to my right was just the case that we found on Tuesday. And these are just, brother and sister from the same family. Now, obviously, they were found late, and it's because they kept going to traditional, healers, hoping that they will be able to address. So, leprosy is still much with us. Now, how do we work together? What's going to be the role of PPSN in this journey? For us, it's that we've seen in you a very viable partner that we can work with. And these are 4 key areas that we think we can collaborate. One is in terms of research, that together with you, we can explore joint research initiatives so that we can leverage on your skills, and also you can also leverage on our 150 years experience as well in doing leprosy work. So that together with you and the PPSN members, we can address to finally push the frontier of bringing Nigeria to zero leprosy. For example, the antimicrobial resistance is a growing concern globally, and leprosy is not an exception. So in terms of leprosy, resistance has been reported, towards key medicines such as dapsone, rifampicin, and clofazimine. It has been reported in several countries, including Nigeria. So in terms of research as a place where we can collaborate, because this concern is a significant threat to us as a people, because it can affect our drive towards the control and elimination of leprosy. And so we want to see working with the PPSN members, leveraging on your experience to see how we can, take advantage of the research opportunities that this will present to us. So for those who are interested in carrying out any research with regards to antimicrobial resistance as it concerns leprosy or even TB, please, you can meet with us after this meeting, and then we can discuss how we will take it forward. By extension, is that the leprosy mission is also open to students, either masters or PhD students, who pick up courses that have an interest in leprosy. We will be happy to work with you to see how we can support you in our own small way. Secondly, we are hoping that we can also collaborate with regards to issues of public health interventions, and then, of course, issues of capacity building. Now, in our intervention, we do a lot of training of health workers. We see here a pool of very experienced intellectuals. And there's no reason why we cannot leverage to invite you, whichever part of the country you may be, to be a facilitator, as an avenue to transfer knowledge to those that we reach in the public health space. And finally, it's in terms of policy advocacy, that we want to work with you, and so that we can leverage on each other's experience to see how we can partner on policy level interventions to influence and strengthen our health systems as a country. At this junction, I would like to say congratulations to you on your 48th conference. And we want to also say thank you for the opportunity that you've granted to us as a people and as an organization. Trust me, we are a good people to travel with, because if we've been traveling for 150 years, I'm sure there is a lot that we can gain from each other. And besides that, we also know where to fish That's one expertise that my boss has on where you can fish for money. And so the international president, it's not an open check. It's only a check that will be open if this honorable house and the board will adopt us on the wings of Professor Ekanem to become a member of PPSN. Thank you very much, and God bless you all.
Before I call in Unia, Zonal Coordinator, North Central, Professor Malam, please step forward. The country director and the last speaker wants to be members of PPSN. So go and meet them.
A round of applause for our new members. So we now have 579 members attending UYO conference, plus 2. All right. Let me recognize, invite, and also invite at the same time Dr. Andy Ayo, the country director of EQUIS, to please come forward. Where are you, sir? Dr. Andy Ayo, country director of EQUIS. Dr. Andy Ayo. Okay. All right. So when he comes, I would recognize him duly. All right. Let me invite here, before I may call their name, I also want to thank them again for what they have done for us here in UYO, for the support. They've actually been very good, and I pray they will continue to be good. I've had a lot about them since I came, of the hands of fellowship that they've extended and are still extending. Ladies and gentlemen, I want to invite the Helen Keller Foundation for the goodwill message. Helen Keller Foundation. Thank you for all you do and for all that you will continue to do. Helen Keller, you're welcome. Please, a round of applause for them.
Ladies and gentlemen, good afternoon. I am honored to stand here before you today to share our work in Helen Keller International. As introduced by the anchor, my name is Nwaniba Ekpudiabet. I'm representing the country director of Helen Keller International, Aliyu Mohammed. I would like to stand on the existing protocol. Hope I'm on the right track. Okay, established in 1915, Helen Keller International works to save the sight and lives of the most vulnerable and disadvantaged persons. We combat the causes and consequences of blindness and malnutrition by establishing programs based on evidence and research in vision, health, and nutrition. Our head office is in New York. Helen Keller's vision is a world where no one is deprived of the opportunity to live a healthy life and reach their true potential, just as our founder, Helen Keller, did. What we do. Currently, Helen Keller International supports programs in 20 countries. Nigeria is one of them. And in Nigeria, 11 states. Akwa Ibom State is one of them. Our efforts include supplementing over 28 million children with vitamin A capsules, dispensing millions of drugs to combat neglected tropical diseases, reaching over 130 million treatments, deworming over 28 million children for intestinal worms, conducting over 12,000 surgeries to improve eyesight, and of course, over 901 hydrocele surgery in Akwa Ibom State. Building health workers' capacities, providing nutrition education to thousands of families, enabling them to generate income and be self-sufficient. We strengthen health and food systems in collaboration with government agencies, communities, and partners. Our NTDs projects focus on eliminating and controlling 5 key NTDs: trachoma, lymphatic filariasis, onchocerciasis, schistosomiasis, and soil-transmitted helminths. We also manage morbidity through surgeries and treatment to restore socio-economic well-being. In food system strengthening, Helen Keller implements 5 key interventions, including prenatal vitamin A supplementation, child diet enrichment, malnutrition screening and treatment, optimal breastfeeding, and vitamin A supplementation. We promote essential nutrition and hygiene actions through food systems, emphasizing water, sanitation and hygiene, climate change, and resilience. Our comprehensive approach supports maternal, infant, and young child nutrition mycin, IMAM, integrated management of acute malnutrition, exclusive breastfeeding, which I had already mentioned. In simple terms, we support early initiative and exclusive breastfeeding, multiple micronutrient supplementation of pregnant mothers, vitamin A supplementation, and consumption of nutrition, food, and water and sanitation. The theme of this conference, Third Food Product and Public Health Concern. This is a well-selected theme for the 2024 PPSN conference. As Helen Keller International, we are so proud to be associated with this conference. It is our hope that representations by experts in this conference would recommend actions to address the very poor indices of micronutrition in Nigeria, malnutrition, and wastage, as evidenced by the National Food Consumption and Micronutrient Survey 2021. We sincerely appreciate the organizers of this conference and will encourage members of the PPSN, of which Helen Keller is going to be a member after now, to leverage our presence in listed states to train students on practical food and health system strengthening. I'd like to recognize the efforts of our friends in the NTD's family, Professor Ken Okpara, Professor Owemekbo, Professor Steve, our prof there, who is always shouting at me when I attend NUEC meeting, "Women, keep your phone down, you're making noise." Thank you very much, Prof. I'm here. Thank you. I would not end without appreciating our very own Professor Ekanem Braid for her immeasurable leadership. Thank you very much, ma'am. Her mentorship support to eliminate NTDs in Nigeria. Thank you very much, and congratulations to all of us.
Thank you very much. PPSN, please note that we have a new member again, so that makes the number at this conference 579. We are going to get to 580 before the day ends. I have that. Oh, how many of you? 2. 581. Herself, her partner, and the foundation. 3 of them. So 581. Please, round of applause for them. So please log on to www.ppsn.org.ng. Follow the prompts, download the membership form, fill, log in, and then voila, you're on board. You are most welcome. The same thing applies, sir. Right. Please log on www.ppsn.org.ng. Membership link, download the form, fill it in, submit, we will determine how much you are going to pay. Because we can't treat you the way we treat ourselves. Have I spoken your mind? The Congress has spoken. All right. Now, it's around. Dr. Andy Ayo, Director Equis. Okay. Oh, sorry, I got it wrong. Please, I will tell that story shortly, not just now. Okay, sit down first. Yes. All right. Please, the two NGOs that have come, that are here, right? They've come here to also tell us that there's room for collaboration. There's room for partnership. There's room to work together. I think that is one message they've come here to say. So our members should not let this go without tapping into it. So we expect that before you go, every one of you, as many as possible, will have a chance to interact with them and look at areas where there could be some form of collaboration to work in your respective states. Even if they don't cover that state yet, there's nothing bad in having a kind of a collaboration to actually work on something that they also they also are interested in. Is all for one purpose: to grant us one health, to get rid of entities, and that's our goal. And remember, 2030 is fast approaching. We are just at the corridors. How far have we gone? That was why I was very impressed when Professor Braid talked about the visibility of PPSN and NTDs. The challenge is not only from WHO. The challenge is not only about the SDGs. The challenge is about all public health workers and scientists globally. And in Nigeria, this is the crop of that in this nation. So the challenge has been thrown to us. We have partners who have come to volunteer that they are ready. Don't let them go. Please ensure that they leave this place empty. They are still full. Make sure they leave this place empty. And they will say, I'm tired. So that is what we should do. Let's tap into that. Ladies and gentlemen, when we came to Uyo some days back, CMC, to start planning with the LOC for this conference, we had some meetings. And issues of utility was raised. You know what is happening in Nigeria now concerning electricity, particularly in our universities. Light is rationed. I'm sure that happens in my place. I don't know about your place because of the new tariff. So they put on light for some hours and then it goes off. So we raised that concern. And we felt that if we're going to hire backup gens and fill it, it's going to be even more expensive. So we approached one man to help us out in this situation. We went to meeting PPSN led by our living ancestor, Professor B. Binwoke, and the president. And we met with the director of works, engineer, Dr. Abasi. Answer. Please stand up, sir. Please, a round of applause for him, sir. We will give you a chance to give us a good message too before you go. He received us warmly. He has never met any one of us before except Professor Okpara and the LOC. We were warmly received. I'm telling you, warmly received. I was so touched that I shed 2 tears. One on my right eye, one on my left eye. I was so touched that, so we still have Nigerians like this that exude humanity. Really, I mean that exude humanity. And when he spoke, I told him it must also join PPSN. So that's 582 secretary notes. So ladies and gentlemen, as I invite Engineer Dr. Answer to the podium to give a good message, please Let us thank him by thunderous clap, because this light has not blinked and he has promised us that he will live. It will not blink.
Thank you. The leadership, I'm happy to be here. You're welcome to University of Uyo. Well, when they came to my office and I told them that it's my job to ensure that you are comfortable. And I'm sure you are comfortable. Well, the Vice Chancellor told me this morning, you have guests? I said, yes. He said, I hope they are fine. I said, they are going to be fine. And I'm sure till you leave, there shouldn't be any issues. I want to welcome you here, and I want to say, please relax. Enjoy the University of Uyo. Should there be any challenge in areas that we can be of help, please, our phone call is just one dial. Thank you, and God bless you.
Please, a round of applause for Engineer Answer again. The newest member of PPSN. We talked about in his office that we could collaborate. He's an engineer, current registered, right? And a fellow, yes, a fellow of current. And we were looking at, how we can bring together engineering and public health. So we can collaborate. All right. Once again, sir, you are most welcome. And thank you for honoring our invitation to attend the opening ceremony. Thank you so much. So we come to the first keynote address. The keynote speaker, Professor Lateef Sani. He has been introduced to us before. And Prof, sir, please, we want you to please stand up. Before, no, just hold on for a while. Just stand still. Right, stay there. While I invite here one of our trustees, the IPP, Professor Mrs. Chinyeru Kaga, to read his citation. Sorry, I learned there's a due citation, so I won't have to belabor you anymore. So, sir, please stand before. Yes.
Professor Lateef Oladimeji Sani, a professor of food science and technology. From the Federal University of Agriculture, Abeokuta, is a fellow, International Academy of Food Science and Technology, fellow, Nigerian Academy of Science, fellow, Nigerian Institute of Food Science and Technology, President, International Society of Tropical Root Crops, Executive Director, Nigerian Stored Products Research Institute. He is a consultant project manager, BMGS sponsored project tank building an integrated economically sustainable cassava seed systems. Basics 2, team lead of EU Seeds for Liberian project and co-lead World Bank Sierra Leone Food System Resilience Program, International Institute of Tropical Agriculture, IITA, Nigeria. He is currently the chairman, Steering Committee of African Women in Agricultural Research and Development Award, and Chairman, Governing Council, Oyo State College of Agriculture and Technology, Igbora. He obtained a Bachelor of Science degree, second class upper division from the Department of Food Science and Technology, University of Agriculture, Abeokuta FUNAB in 1990. Then Masters of Science and Doctor of Philosophy PhD degrees from the Department of Food Technology, University of Ibadan in February 1993 and April 1999 respectively. He began his academic career as an assistant lecturer at the Department of Food Science and Technology, University of Agriculture, Abeokuta in 1993 and rose through the ranks to be promoted to Professor of Food Science and Technology in 2008. He has 32 years of experience as a post-harvest expert on tropical root crops, mostly with the Natural Resources Institute in the United Kingdom and the International Institute of Tropical Agriculture, the Association of African Universities, the West and Central African Council for Agricultural Research and Development, the International Society of Tropical Root Crops, with members spread across over 35 countries. He was also the country manager for the Bill and Melinda Gates Foundation funded Cassava Adding Value for Africa 2008 to 2019 project coordinator and work package leader for EU, African, Caribbean and Pacific Scientific Capacity Building Project. 350 young scientists trained in Nigeria, Uganda, Zambia, Fiji, Trinidad and Barbados. He led IITA African Cassava Agronomy Project's component on the validation and dissemination to commercial farmers and the African Development Bank AFDB technology for agricultural transformation products and quality support to Togo and Nigeria. He served as the resource person, World Bank sponsored project titled Upscaling the Nigerian Flash Drying Experience for Sustainable Regional Trade and Income Generation in West Africa, Ghana, Benin Republic, Sierra Leone, and Nigeria. He chaired the local organizing committee that successfully organized the 16th ISTRC Symposium in September 2012 at the Federal University of Agriculture, Abeokuta, with 355 participants from 32 countries and 5 continents in attendance. He is the President, West African Association of Food Science and Technology, and Chairman of the Board of Trustees of the Nigerian Societal Reformation and Peace Foundation. He has, in collaboration with colleagues in Nigeria and overseas, attracted over $50 million research grants while working with NRI Greenwich University UK on DFID, EU, BMGL funds, IICA, GAIN, AAU and McGill University. He is a recipient of 22 scholarships, fellowships, awards, prizes, honors, and recognitions, including the 2011 FUNAB Research Productivity Award, Senior Academic Category, 2012 FUNAB Most Outstanding International Ambassador, and 2008 Consultative Group of International Agricultural Research CGIAR Award for Regional Technology Development in Sub-Saharan Africa. He was a former Deputy Vice Chancellor, Development, Dean of Food Science and Human Ecology, Director of E.G. Leventis Memorial Center for Learning, Deputy Director, Center for Human Resources Development, and Head of Department, Food Science and Technology in FUNAB. He has supervised over 100 undergraduates, 17 masters, and 34 PhD students. Published 136 journal articles, 30 books, 30 conference proceedings, and patents with Google Scholar, Scopus, ResearchGates, and 2023 AD Scientific Rankings of 4,912, second best researcher in FUNAB, and third best researcher in Nigeria. He is a member of the 2020 UK Research and Innovation International Development Peer Review College. He has assessed 26 professorial cadres in different universities in Nigeria and abroad. Served as editorial board of the International Journal of Food Science and Technology. He is an erudite scholar, passionate innovator, a team player with social skills, dedicated researcher, a mentor, manager, advocate, and role model in sustainable development and transformations. Professor Lateef Oladimeji Sani is happily married to Professor S.A. Sani and blessed with children. Ladies and gentlemen, I present to you Professor Lateef Oladimeji Sani, a professor of food science and technology.
Thank you very much. The international presidents, even though I'm supposed to first of all greet my own mama, the President, Nigeria Academy of Science, and Chairman of the BOT. My teacher, my mentor is also seated, Professor Mafiana, and all other colleagues that are also here. PPSN, I want to first and foremost extend courtesy to the Vice Chancellor for hosting this annual conference, and also thank the President for inviting me to give this keynote address. It's been on me since February this year, and it's like he was predicting what will happen because I have 4 consecutive engagements as I'm standing in front of you. I'm supposed to be in Côte d'Ivoire. I'm supposed to be in Sokoto. I just find a way of sending some people one way or the other. Now, briefly, because time is spent, we're going to talk on stock products. You can go on. I talk very fast. So, and I thank God that all the speeches since morning have talked about the issue of public health, food safety, and we have given empirical evidences of water problem that we have. And once you have water problem, definitely you are going to have problem with the resultant food. Next slide. The critical point now is that how do we attack the issue of these stock products? You cannot do it if you do not discuss the issue of food storage. The point is that I want us to note, every one of us, the farm that we have, the commodity move from the farm to the market. Either you buy from the local market in Brass, or you buy from the local market in Dawanu in Kano, or you go to ShopRite. Every one of them are passing through supply distribution channel. And there's a problem of packaging, distribution, of carriage of the food products. And that is where we need to now show more interest because of the microorganisms infections. The importance of storage of food is very there. But the problem is, you know how many times they've taken light, as all of us are here. That's number one problem, that will not allow us to gain the issue of having safe, wholesome, and high-quality food during storage.
research paper, which you also presented very brilliantly. Prof, thank you very much. He has taken us through the whole gamut of stored food products and public health concerns. So in our tradition, we'll take one or two questions, and if there is any contributions, we will be able to take that in a few minutes before we can go into the second presentation. So if you'd like to ask a question, just indicate by raising your hand. We will take the numbers, we take all the questions, and he will respond at the same time, and then we go to the next lecture. So, questions, contributions. Yeah, I'll give you numbers. Number one. One there. Two. Okay, I'm being, to save time, I'm being told that if you have the questions, write them down, pass it on to the table, and Prof will find time to respond to you. So once again, a round of applause for him. So Prof, thank you very much for the wonderful lecture. Thank you.
And thank you too, sir, the Vice Chancellor. All right, we move on, please. So, as has been said, if you have any issue, comment, question, collaboration to raise, discuss with Professor Lateef Sani, please kindly write, indicate write the issue name and put your email address, and of course, you can start a conversation through that. Yes, I'm just being informed that Professor Sani is not going anywhere yet. He's going to be around today and tomorrow, so the conversation can be extended and deliberations continue. So please also make use of that opportunity to see how much we can tap from that wealth and depth of knowledge and research. Once again, Prof, we thank you. Well done. Right, so we'll move on, please. Please, I want to invite the President, and I really want to do that, to lay a foundation or a pre-discourse to the next item, which is the launching of Professor J.P. Fabi books. I don't want it to be repetitive. Let me just allow the President to give an introduction into this before we invite our trustee, two of our trustees, to lead in the launching. President, sir.
Good afternoon, everybody. Professor Fabi, if you go to page 34, you will see his contribution. Professor Fabi was president of PPSN 1989 to 1993. He served for 2 terms when it was 2 years as president. He said he wanted to bequeath something to the society at this conference. And he said he wants to bequeath it because he does not know what will happen tomorrow to him. So he put down 3 books and requested that the chair BOT present these books and launch. He is only interested in passing information to the society. But then, these books were produced with an amount of money. He's a retiree, emeritus professor, so we want to recoup his money and send back to his account. I have the honor to call on Professor E.I. Braid. I find it difficult calling her full name because she's my mother up there. And Professor Adamu Tuku to come and present Professor Fabi 3 books, and also request that members subscribe financially to the account, which will be projected now. Thank you.
Good afternoon once again. Okay. I'm just being told that Professor Fabi was external examiner for Professor Tuku. So these are the books. So I'll invite Professor Tuku to do his external examiner some honor.
Well, International President, Chair BOT, my role here is to assist you. Well, there are 3 books here. One is on diagnosis. The second one is checklist geographical distribution. The third one is control. If you take them in that order, this one will help you to do the diagnosis. Very important. In doing the, which is very important in deciding how to do the control. So having these 3 books, diagnosis, mapping, and control, is very important to anybody who is interested in parasitic disease control. They are handy, and I am sure each and every one of us would like to have these copies. With these few remarks, I would like to invite Professor Sani to launch these books.
No, don't announce it. Just say.
Announce money.
Your hosted value will increase.
All right. The elders have discussed, and to the glory of God, I have launched this book. So that's the announcement. Thank you very much.
So he will discuss his launching with the international president. So on this note, I'd like to invite anybody who wants to launch this book to come up. Where's your...
Angie now.
Okay, please come up. Come. Anybody who wants to launch, or any establishment that wants to launch, universities, please walk up to Banji and let him record what you have for the launching. And that will be the end of the launching. We don't want to do launching. Thank you.
Thank you very much. Thank you.
Thank you.
The next item. Next thing now, I don't want to go around now. I know. How can we play more music? Music department. All right, so all right, please let us buy these books. Please, the minimum amount fixed to each of them is 3,000 naira. You can do better than that, please. Minimum 3,000. There are 3 different types of books. If you are picking the complete set, that is 9,000 naira. If you are picking 2, 6,000. But because of the status, account number is there. If you want to transfer, please do so. The status of our professor and past president, you can do better than 3,000 naira. You can pick a copy for 10,000. You pick the 3 for 30,000. So you are actually assisting his ministry by doing that, really, and his intellectual industry as well. So please, ushers are going around with the books. Music department, let's have stoppings for just a minute or 2. Then we'll proceed with the program. So note minimum of 3,000 naira. If you don't have naira, you can pay in dollars. We'll change for you. Your change may not be complete or exact, but we'll still give you change. Please show, it's on the screen. The account number is on the screen. It's a First Bank account number 200-152-5531. Please make sure the name that comes when you log that in is Professor J.P. Fabi before you conclude the transfer. 3,000 each, 3 different books, 9,000 a complete set. Please support Professor J.F. Fabi. Support Professor J.F. Fabi, please. Thank you as you do that. So please,
We still have more copies. If you have ushers, please. We still have more copies here.
One love, one heart.
So please, ushers, move round. I can't see anybody at the back there with any of the books. If you want copies, raise your hands up, please. Ushers, their hands raised here. Please, their hands raised here. If you are coming for tomorrow's program, the tag to enter is a copy of any of these books. If you don't have any copy, you will not be allowed entry into the hall tomorrow. So you better buy your access ticket now.
Really love to.
Please, if you are paying to the account of Professor Fabi, send the receipts of that transaction via WhatsApp to the President, Professor Sam Wobo, so that we can document what came through this assistance to Professor Fabi. Once again, if you are transferring to his account, once you have concluded, send the receipts to Professor Sam Wobo, our President, via his WhatsApp channel. There are hands raised here, please. Please get more. People hands are here. We are coming, please. How many? 10. You want 10 copies? Hey, 3 times 10, that's 30. How many copies, sir? 3. Okay, we are coming, please. So please get the books to the back.
Let's get together and feel alright. One love, give thanks and praise to the Lord, and I'll feel alright. Let's get together and feel alright. Let them move, let it remind. One love. There is one question I really love to ask. Is there a place for revelation?
So please, please, the account number is on the screen. Once you transfer, send the receipt to the President on his WhatsApp number. If you are paying cash, please pay immediately to the ushers.
Give thanks and praise to the Lord.
Pay to the ushers immediately. Thank you for supporting Professor J.P. Fabi, one of our ancestors as well. Buy one, buy a set for yourself, a set for your library, a set for your library in your department, a set for your faculty library, a set for the university library, a set for your library at home, and then give somebody a nice gift this season, a set as well.
About a thing, 'cause every little thing is gonna be alright.
Smile at the rising sun. Little birds, each by my doorstep.
If you still want copies, please indicate by raising your hand up so the ushers can come to you wherever you are seated. If you want to buy, please indicate by raising up your hand, and the ushers will meet you wherever you are. Once again, the account to pay to is on the screen. All right. Hello, ushers. Usher.
about a thing. 'Cause every little thing is gonna be alright.
Over there. If you want to buy, please indicate with your hand raised up so that we can actually reach you. Thank you so much for supporting Professor J.P. Fadi. Thank you so much.
Rise up this morning.
All zonal coordinators should buy a minimum of 5 sets for their zones. It now depends. Anyhow they want to sell it is their problem. Dr. Lebari, please, 5 sets each for all the zones. So, zonal coordinators, you will receive 2 copies or 5 sets of 2 copies. 5 sets. So that goes to zonal coordinators. All zonal coordinators, the 6 of you. 5 sets for each zonal coordinator. 5 times 2, that is 10. And 10 times 3, that is 30,000 naira from each zonal coordinator. 30,000 naira. And your zone must not remit 30,000. You remit at least 50,000 naira. At least 50,000. Please let them have it. All zonal coordinators, 5 sets each. Go to your zone and send that money latest by next week. 50,000 naira each zone. Ushers, please come and give to zonal coordinators. Ushers, please come around. Is that for zonal coordinators? 5. Oh yeah, come. Oh yeah, put 10 in front of her. 10 copies. Put it. 10 copies. 5. No, it's the same thing now. No, there are 2 types left. So come with 10. Zonal coordinator South, you are represented. 50,000 naira Konaka. The next 10 copies, please. 5. Dr. Lebari, please. 5. 10. Zonal coordinator Southeast. I cite you. Any zonal coordinator that leaves this seat now, in fact, we take times 2. Please, next 10 copies for Southeast, please. Zonal coordinators, you are paying 50,000 for what you have received, and the money must come in by next week. So when you get to your zone, tax your branches. The next 10. Dr. Lebari. Zonal coordinator Southeast, we cite you 50,000 naira Konaka. Thank you. You are supporting a legend. It is money well invested. Next 10. Count 10 copies. Zonal coordinator North Central. Besides you. 10 copies. 10. Count 10. It's more than 10. Madam, go for library. We are selling. Donor coordinator Northwest. 100,000 naira. You are elegant. 10 copies. 50,000 naira Northwest. Donor coordinator Northeast. Northeast. 50,000 naira. Thank you. Southwest. Professor Kisoya. Bring. All right, thank you very much. You can bring the rest back. Please, music department, calm down. Thank you very much. So while others are still buying, please, we want to thank the zonal coordinators for purchase these books. If you have not spoken up, how would we have sold this number of copies? We thank you so much for support, Professor Fabi. So ZCs, we expect your debits or the alerts, the receipts to get to the president latest by next week Friday. Just a minimum of 50,000 naira only from the 6 zones. Thank you very much and may God bless you. We're moving on. The next item on the program is the launching of the 2024 PPSN NTD reports. May I invite to do this, may I invite the BOT Secretary, my own very Oga, Professor CF Mafiana. Prof, sir. Do you need a basket for the money?
No money. The chair of the BOT and members, Mr. President, and the Executive Council have been asked to launch, right, the NTD 2024 report. As has been told us earlier in the day, our society, PPSN, as we know, was formerly the Nigerian Society for Parasitology, NSP, which, my brother, excuse me, please sit down. Our society has metamorphosed into a star of great size and luminosity. And what we are enjoying today is a result of the energy as well as the zeal that our progenitors have put into bringing the society to being a flagship. It is also a very important player in tropical diseases research and control. This edition, the 2024 NTD report, documents what our various chapters, zonal chapters, have done
in attempt to raise awareness toward uniting as well as acting toward the elimination of the NTDs. I'm informed that this report will be made available immediately after this conference. Okay, immediately after this little talk, the report will be made available. And the icing on the cake will be that three zonal chapters will receive awards for the substance contained in the report. How that will be, I don't know. So it is my pleasure to formally launch and present the 2024 NTD report. Thank you.
The NTD report is now live on PPSN platform. So you can download the NTD report. But I'll call on, there was a committee, the secretary of that committee, Dr. Ojo, to come and read out the names of the three outstanding zones.
Good afternoon, everyone. On behalf of the committee of the society, known as the Honors and Privilege Committee, I would like to present results of the assessment of the activities of the entities for 2024. Sirs and Mars, I'd like to say that marks were awarded to number of activities embarked upon during the week, the qualities of the activity, number of participants or participating chapters within the zone, the reach of the programs embarked upon were assessed, and of course, duration of activities was also judged. In no particular order, the first three zones, in no particular order, are North Central, Northeast, and South South. The second runner-up, meaning the third position out of the three, goes to Northeast Zone. Congratulations. Northeast came third. Congratulations. They came third with 66.25%. Congratulations. Congratulations. The first runner-up, meaning the second position, with a score of 71.5%, is the North Central Zone. Congratulations. 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 Of course, by now it is clear that South-South Zone came top with 74%. Champions for this year NTD Day celebration. South Zone. Congratulations. Congratulations. Congratulations to South Zone.
Yeah, thank you. This award is to the best overall zonal coordinator. And the best zonal coordinator is Nkiru Oji.
Lonely adult, lonely. Only on my mind, Monday morning. Don't care what they yarning about me in particular. Out here, just a matter because one can chase it for me. Ololola de mama, Urakatani Ishamala. If you don't find any money I want. No day waiting people they tell. One thing I shall get you to love. I see them now, no get another one. I go take it away till now. Waiting you love. No be waiting I love. Waiting I love. I go do with all my heart to. Okokoro no be fun.
BOT chair, please, we have two outstanding awards. One is the outstanding council member award, and the other one is the outstanding PPSN member award. Please, I want you to come and present that one before we go to the next. The outstanding council member is Mobolanle Oniya.
Only your mama.
Thank you very much. You don't stop men from watching, and you don't stop God from watching. Whatever a guy sows, there's always a reaping period. For every action, there's a consequence. And this one has a positive consequence. Is she allowing me to carry this in for long?
Mr. President International, I am beginning to wonder whether they were talking about somebody else, not me. You have got me this time around. Distinguished parasitologists, PPSN, PPSN, and PPSN. It's like I'm still dreaming. Some 51 years ago, I had the privilege of being a pioneer NYSC, 1973 precisely. And I had then in our days then, you had a choice. I decided to go to Benue Plateau because I didn't want to remain in Lagos, being a Lagos boy. I got to Jos. Where will you go? I was posted to school. I said no, I want to do research. Then I was posted to NITA, Nigerian Institute for Trypanosomiasis Research, VOM, a branch of NITA itself in Kaduna. Let me cut it short. I had two wonderful bosses then. May God rest their souls. One of them is still here now. Mama is there. You know, they can drive you, but with a lot of love. They took me on that field trip to the hospital at Boko in Benue Plateau State. A 32-bed hospital. BEB is laughing. He knows what I'm going to talk about. Now, for you to be able to obtain for late stage of human African trypanosomiasis or sleeping sickness, you must have that dexterity of using what we call the lumbar puncture needle. And you go in between the vertebrae to collect the cerebrospinal fluid from there. Of course, we had men who were called the rural health superintendents then. They attended this school in Kano and somewhere else. When you say dexterity in performing lumbar puncture, they were there. And one of them that took that lumbar puncture, God rest his soul, MS Mohammed, brought out the whitish or creamy CSF. And I had the privilege of being asked to examine it under the microscope. What I saw gave me goose pimple. I saw the trypanosomes wriggling between red blood cells live. From that day, I decided I was going to find out how we were going to make sure that our people do not suffer from this anymore. International President, we met last year, December, when I had the privilege of being awarded the 70th anniversary Child Savers, award, whatever contribution they say I've made, I don't know. Now he said, I would like you to come to our conference. I said, who am I to say no? From that particular moment he mentioned it, until as I'm speaking to you now, I have not slept. I have been dreaming, I have been drinking, I have been waking, I have been eating trypanosomiasis and onchocerciasis elimination in Nigeria. True story, true story. When I'm sleeping, I will wake up and run to the sitting room and go and start scribbling things. And of course, I gave him two presentations. I said, choose ye today which one you will take. And he chose one. And that says, trypanosomiasis and onchocerciasis elimination efforts in Nigeria. Well, can I have the first slide? So jumbled, I'll go to the next one. Okay, thank you. Will I start telling us about the life cycles of the trypanosoma? Well, we won't waste more time. The point remains that there are two broad types causing human sleeping sickness. All right? Trypanosoma brucei gambiense and Trypanosoma brucei rhodesiense. Now, one is R. gambiense, the other one is R. rhodesiense. Let me add very quickly here that when it is long, you left Abule, go and find out the meaning of Abule. If it's long, you left the Abule and went to diaspora. And then you now come back to the village. You know what? You will start asking of dead men and women who have long gone to meet their ancestors. That's what international president did to me. I left Onko and Trip for many years, working on integrated disease surveillance and response with particular reference to polio. Thank you, ma. Poliomyelitis. Thank God they have eradicated polio. Nobody remembered me, international president. You are remembering me now. In a place I left many years ago. You are remembering me, and God will remember you, sir. You and your team. Can I have the next slide, please? Human African trypanosomiasis occurs in characterized foci. As far as we are concerned, in Nigeria, it was said to be in the north, but as far as I know, it has now shifted down south because of transhumance. Now, geographical prevalence is directly proportional to the distribution of the vector, which inhabits plants and water sources. We are being told there are over 300 HAT foci across Africa. And of course, transmission intensity is not well known in hard-to-reach areas due to environmental conditions and lack of effective surveillance system. It has always been touch and go for HAT, in the sense that the major jobs that were done on HAT in this country were funded externally. I can't remember when government brought out money and said, let us do a disease surveillance for HAT. Having said that, we are thinking of the elimination strategies now. You have passive case detection, active case detection, vector control, and case management. Can I take you through progress? From 1930 to the early 1980s, a lot of efforts have been made to try to control this menace. Let's pause for a while. I had the privilege of getting a grant from the World Health Organization, TDR, to try out card activation tests for trypanosomiasis, CATT. Then we took it to the then Bendel state, Abraka axis to be precise. Almost 700 people were examined, men and women and children. And of course, it was mixed with parasitological tests, which is you take blood samples, you examine, you take lymph nodes. Of course, if there are serious cases, you do lumbar puncture. We had a large prevalence of the disease in that area. And we referred those who were positive to Akwa Baptist Hospital. I now said, we must go and give this result. Like Professor Sani said, there's always this policy, advocacy deficit. We got to the State House of Assembly. We are looking for the speaker. I don't even want to remember his name anymore because he was not empathic at all. When I tried to describe how sleeping sickness affects people in impeccable pidgin English, I told him that people sleep in the afternoon. Insomnia is one of the clinical features of trypanosomiasis, but they cannot sleep in the night. You know what he told me? He said, doctor, why you worry yourself now? Make them sleep for afternoon. For night, they go do megad. Let's get to, true story. Funny enough, the chairman of the local government where I was born, I went to go and see him because of the contiguous nature of his own local government to where we found these cases. He was quite nice. He ended up being two-time governor of the state when he became Delta. The same as the Commissioner for Health. Distinguished parasitologists and public health practitioners, I cannot tell you in their 16 years whether anything was done about sleeping sickness in the then old Bendiel state. I cannot vouch for them at all. That shows there was no empathy at all. Now, in the early 80s, it was no longer a public health problem, as the prevalence has dropped, to less than 1 in 10,000 in 1976. Of course, we have persistent infection in some foci. The question we're asking ourselves now is, if you did not do proper surveillance, what moral right have you got to say that the number of cases you are getting are low? You can't say that unless you've done proper, surveillance, which is what is lacking as far as, HAT is concerned. Excuse my parachute. I wanted to appear old and responsible. Thank you, Baba. Can you imagine? I'm being given presidential attention. Can you imagine that? Thank you, sir. Let's quickly run through the interventions. Wash is one of them. Of course, we have vector control. Vector control was very, very well taken care of. WHO had what they call WHO Vector and Biology Control, BEB, and my chair, you remember, BBC, good. In fact, there was this, was it from Pakistan or wherever? He was in charge, Kaduna Road there. Thank you very much, sir. Now, they did a great job. But the point remains that there is no way you can barricade your land and say the fly should not come. It's not like America where you say aliens should not come to your place. You cannot stop flies at all. And of course, veterinary public health, fantastic for the animal disease. When once in a while we talk about failed treatment. For the human being, so long as you are able to get cases early enough, you are sure of getting prognosis. But if it is too late, when the central nervous system has been involved, I'm afraid the drug of choice is quite toxic. It's neither here nor there. And of course, other cases are detected through your active, mobile units. That was well known in those, they had teams going from village to village looking for cases. That kind of money is not available now. And the important thing is, there is a large expanse of land, over how many thousand square kilometers, almost going to 1 million. Nigeria is a very large country. I remembered my supervisor then was telling the son, oh, Henry is from Africa. I stopped him. I said, sorry, sir. Andrew, your father is wrong. I am from Nigeria, a country 4 times the size of Britain. I didn't put great. Nigeria is a large country, so you don't look down on us. Now, we have been making effort to combat both diseases. And so, the British government in 1947, by an act of parliament, decided to establish West African Institute for Trypanosomiasis Research, WAITA, branch headquarters in Kaduna and VOM, supposedly cancer-free area. The rest is I happen to have called Mr. President to join the NITA team to the National Assembly to go and tell them why NITA should not be subsumed into another institute or scrapped totally. You know what the chairman of the ad hoc committee told us? That we will give the KPI of NITA within 2 minutes. An institute founded in 1947. I think you must have heard that acronym, KPI, for the first time. Give a KPI in 2 minutes. Of course, that we are discharged but not acquitted. I told him, he didn't listen to us. NITA is a heritage institute. NITA is not just any Nyama institute. NITA was a sub-regional institute. There's IATRO, there's UTRO, BEB. Thank you. There's IATRO in East Africa. There's Uganda one. Now, we are trying to truncate it. Whether we like it or not, NITA will survive. Vector control. You will see the biconical nest for the vector. This was developed, this very one was developed in NITA. It's called the NITA, type. Then Ikot, biological control of session. Brilliant idea where sesefly, Glossina palpalis, supposed, carrier of Trypanosoma brucei, brucei gambiense, was being bred at Ibom. Ikot did a good job. They were able to breed literally thousands of these seseflies, sterilize them, irradiation they called it, and then release them into the atmosphere. The basic technique, which is SIT, is that when they mate with a female in the wild, there will be no reproduction. It will be abortion, that's the word. It will be a wasted, effort. In fact, if you look at following the trends again, from 1950 to 2022, you can see the areas where we now have, cases. Old and new fossil. The 1989 one we did in the then Bender State was a known endemic fossil, but nobody said anything about it. And of course, there are areas where we have newly reported cases. The latest was somebody that went to the United Kingdom and they discovered that she had sleeping sickness. And to tell you a good story, that person was a very good specimen because they will take both relevant and irrelevant specimens from that person. They will collect blood, they will collect sputum, they will collect a lymph node, you name it. They will do biopsies. At the end of the day, they don't have the expertise to tell whether this person is carrying Trypanosoma brucei gambiense or not. That's a story for another day. Now, down here is what we have remaining now. Yeah, you can see it down here. The same thing there. That's what we have, remaining. Yeah? From Abraka axis. Yes, sir. Thank you, sir. The year 2010 and 2014, we're talking about 0 cases reported. I must confess, distinguished parasitologists, we have a problem in this country. I am guilty, or I was guilty. I'm not working again. But I was guilty. Report properly. We do not. And this issue of sporadic surveillance, sir, we must try and stop it. Let's look for funds to do proper surveillance. Proper one. It's not just you go to a small place and then go and look at 600 people somewhere. No. Just like we did for onchocerciasis, map out the area. Let's think of mapping technique for HAT and AAT. Now, of course, the last case, like I said, was the person who went to the UK. Now, looking at this chart, the last time any case was reported officially was 2016. There will be this erroneous belief, we have been able to eliminate human African trypanosomiasis. But that case that went to England was a pointer to the fact that our surveillance system is very, very weak, and we have to do something about it. But the same thing goes in there. What are our challenges? There is a lot of knowledge gap in diagnosis. Of course, you do have resistance, to the drug for the animals. And whether we like it or not, there is, I keep saying it, there is a very weak disease surveillance and monitoring system. We have to improve. Otherwise, we will not be able to meet that target of 2030. Same thing there. Same thing. In fact, if you look at here, eliminating the disease where it is no longer a public health, importance or as a public health problem, you will see that Nigeria falls in the second red area with the likes of Gambia, Guinea-Bissau, Liberia, Mali, Niger, Senegal, and Sierra Leone. Now, what is the master plan for HAT elimination? Number one, capacity building. That's why I'm very proud of PPSN. Very, very proud of PPSN. When you see there's a workshop, and things like that. Training of personnel on HAT and AAT doses and management. Massive surveillance in all at-risk areas, villages, sharing a boundary, particularly with the Ethiop River, should be taken into consideration. And of course, the adjoining state of Edo State should be looked into also. Active surveillance in Abraka, Eku, and villages bordering the Ethiop River, like I said, must be A1. HAT is listed among the IDSR, that is Integrated Disease Surveillance and Response. There are about 44 diseases listed on the IDSR, and HAT is listed as number 2. By 2030, which is the roadmap, are we going to meet that roadmap? That's the question I want you guys to think about. Because we need to collaborate and have multi-sectoral approach to this issue. There was a paper I was reading, Mr. International President. It was as if the team was lifting the data from another paper and saying it's their own data. Plagiarism. It's a major problem for us Nigerian scientists. Because you want to be promoted as professor. That's why I'm not a professor today now. I don't know how to plagiarize. If I do it, I give it to you as it is. Mine is research results for action. This guy picked results like that. I'll send the papers to you, sir. He didn't even mention one of the papers that he picked the result from, the data from. We must stop that. It's not good for us. And then, monitoring and evaluation is another issue. We must do that. It is very, very important. I know it is difficult for us to have funding. Like I said, for a member of the House of Assembly to be telling you, doctor, leave them now. Make them sleep for afternoon. For night, they go do mega work. Somebody who can't stand. Somebody who is frail. You are not empathic. Or HAT and AAT. Let's go to National Onchocerciasis Elimination Program. Onchocerciasis seems to have been properly taken care of, Mr. President. Properly. It is highly funded, particularly externally. Okay. Thank you, sir. See them. Mama Braid, BEB, Dr. Mafe, Wukaga, Mafiana. Their own is river blindness. It's no river blindness. The parasite is onchocerciasis blood, you know that. Simonium is the vector. That's the one that carries it. Symptoms, severe itching, skin conditions, disfiguring, visual impairment, which can lead to permanent blindness. Okay. More than 99% of infected people live in 31 African countries. My distinguished Professor Osani, what will you store if the farmers are blind? What will you store if the livestock industry Sorry? What are you talking to me? No. What will you store, sir? If agriculture is like this, it has plummeted because of these neglected tropical diseases. So there must be a need for us to collaborate with you to produce before you can store. The pre-control era, that is when you have the National Onchocerciasis Control Program. It was launched in 1982 and became operational in 1987. The program now transitioned to the National Onchocerciasis Elimination Program by May 23rd, 2013. International President, we are best in society. The chairman of that NOEC, members, they are here. Are you aware? The chairman is Professor B.B. Nwoke, Dr. Mafe, Dr. Karadiao in that committee. So I don't see any reason why they should not identify people among our brethren here and get them involved in how we can meet that target of 2030. There was one remarkable thing that Nigeria did, International President. In 1975, my friend Pierre Ngomu, a Cameroonian, God rest his soul, and Jay Walsh came up with rapid epidemiological mapping of onchocerciasis, aka REMO or REMO, call it whichever way you want it. That same man there, Professor B.B. Nwoke, went as far as doing REMO for other African countries. No, he did. No, he did, Prof, he did. But he was so good that, like Professor Sani, that they had to take him out. No, we need him, but he has finished his own country's own. He did Nigeria's own. Gemade was our principal. UNICEF sponsored it. Professor Braid was involved. Mape was involved. Our distinguished professors were all involved. Late Ogumba, Professor Kale, Professor Edumbola, I worked with two of them. And I worked with Her Excellency. Oh, of course, yes. Remo was the game changer. Because Remo will tell you exactly where to go and get your cases. When they did that Remo, the area was divided into three: hyper-endemic, meso-endemic, and hypo-endemic. Thank you very much, ma. That shows at least when should you treat, when will you not treat. Now, Bayelsa, Lagos, and Katsina states were determined to be hypo-endemic and therefore did not meet that threshold of endemicity to be involved in MDA or mass drug administration using ivermectin or mectizan. The control program of then was to reduce the transmission of onchocerciasis to a level where the disease will no longer be constituted as a public health problem in Nigeria. Carry on. Then came APOC, African Program for Onchocerciasis Control. Again, Professors Braid, P.B. Nwoke, and Dr. Mape were involved in what about APOC. And yours sincerely was involved in the original inaugural meeting that was held in Mukono to fashion out the introduction of APOC into the African continent. And it was supposed to have been for 20 African countries, including Nigeria. And of course, the NOEC, working assiduously, is trying to move the train forward so that we'll be able to meet that target of 2030. They are to provide technical advice on elimination to the Federal Ministry of Health and Social Welfare. They are to support the government of Nigeria to develop a national guideline and roadmap for onco elimination in accordance with the WHO guidelines. And of course, they are to assess where and when breakpoints have been reached and to recommend areas where ivermectin treatment can be safely stopped. That is, no more treatment, whether yearly or biannually. They are supposed to support the government in the preparation of the countries for verification and having to show that Nigeria has interrupted transmission of the disease nationwide. This committee is their job. And of course, the program objective, consequently, from control that has changed now to reducing transmission to a point where MDA is no longer used, even after stoppage of when you have eliminated. Change was based on emergence of evidence of effective drug for treatment and reliable diagnosis to measure impact. There shows you the pre-control era. That's the Remo map on my right. All the red are said to be hyper-endemic, and the green, and so on and so forth. Like I said, Professor Braid, Mafe, Ukaga and Co. were involved, in letting this happen. Now, when this is a scheme manifestation, when APOC came on board, APOC supported, in collaboration with WHO TDR, a multi-country study on community involvement in the use of ivermectin, the treatment of onchocerciasis. Ladies and gentlemen, it is with gratitude to God and all humility that I say that out of the eight sites in 5 countries, Nigeria had 4. 4 out of 8. Dr. Mafe, 1. I was privileged to be 1. Akogun, the former officer 2, was 1. And then Professor Richume. We came about CDTI, community-directed treatment, which became the veritable tool that APOC used in working in the 20 countries of the world, of Africa, beg your pardon. I like this chart. BEB has a hand in it. BEB, I can see your hand in this chart. This very one. The blue one is telling you that it's endemic. Evaluation, no. Keep it at bay. Then, of course, this red area, that's the one that's our major. Remember, ladies and gentlemen, that for any disease, if you make the mistake of thinking you've eliminated it somewhere else, there's no barrier. You will not ask the blood line to remain in your own water level. No, they will not stay there. They will have to move. And you will not ask people to remain in their place. People will move with their cattle from the north and to the south. What will you do? You will always do constant surveillance to make sure that your borders are well protected. Well, of course, if you look at this one, look at that, it's telling you any areas that are yellow. Yellow means they have suspended treatment, meaning that onchocerciasis has been interrupted. There are 2 things here now. You can only stop treatment if you meet the criterion that says you are no longer getting microfilariae from the people. And of course, when it is yellow, your interruption is, when it's ongoing, that's where it is red. There is no determination. It breaks my heart that many states, Lagos, Bayelsa, Rivers, Akwa Ibom, Sokoto, Katsina, Jigawa, etc., they don't have any proper information. I don't agree with Sokoto because I had the privilege of working in Sokoto, in fact, and Katsina. So we need to cross-check that information. And of course, when transmission has been eliminated, you will have the green that we had in that map. This is their matrix by Professor Ibom and his team. Matrix 2. Now, we have talked about the objective. Children playing by the water side. How do you implement your strategy? Onco elimination map, you must do that. It's not like Remo, but you want which areas are able to interrupt transmission. Which areas have good treatment? And of course, PTSS is your post-treatment surveillance. Once you stop, you must continue to do surveillance. And your PES is post-elimination. 3 to 5 years are supposed to be BEB. All right. Then of course, you have to use entomological and epidemiological strategies to confirm whether you have been able to eliminate these diseases there or not. That's what you have, there. This nationwide sample size for EPID and ento evaluation. This is a map I say, why can't we do a similar thing for AAT and HAT? That's the message I'm passing. Why can't we do a similar thing? Children with skin nodules. They took the Plateau State example, where they selected EPID sites and epidemiological sites on the river system in Plateau State of Nigeria as an example of how these sites were chosen in all the states. Thank you, time people. That's why I'm not a lecturer. A lecturer that has time. He invited me. So until I feel what I'm doing, I won't leave this podium. By December, is it a lie? You invited me to your party, and now you're putting time in front of me. What has taken me months, sleepless months. Transmission, Plateau State, Nasarawa, all right? So you are now in state of post-elimination surveillance. Then transmission interrupted, Kebbi, Kaduna, Zamfara, and Co. So those ones are in post-transmission surveillance. I hope it's clear. Once you stop treatment, it's PS. Once you've eliminated, it's PES. Let's leave that and move on. So these are, by December last year, Professor BEB and his team, that's what they have. We only have a small place where this thing has been, eliminated. There. That is in Plateau. Although science savers say they've eliminated in Kebbi, Zamfara, Sokoto, but they need to be validated by the NOEC team. What are the targets? Well, to stop MDAs in more than 50% of the population. In Nigeria, they say we're on track, and I wouldn't say no, because trying to use modern technology. Can you imagine an old man trying to talk about AI? What's my business with AI? But, no, on a serious note, but when I tried it, I now realized that it gave me a lot of confusion. I had mapped out how I wanted to start this paper. You can imagine having 2 papers now. And my prof said, okay, I'm taking this. That's what I'm presenting now. All right? Technology can be good. It can be also bad. Nigeria aims to be one of the 12 countries to stop MDA in the entire endemic population. If our security situation improves. Farmers don't go to farm, Professor Sani, where I'm coming from in the north. Zamfara has been taken over by the owners of the land in the night. People don't move about anymore. Well, achievements, like I said, that's the map. As at May 2024, beautiful. What are our strengths and opportunities? There is a coordinating role from the NGDOs working in tandem with the NGDOs and the Federal Ministry of Health. I beg your pardon. There is that unwavering and consistent donor support. Donor support is finished, But the NGO coalition, Helen Keller is here, they are doing the best they can with frequent meetings of the NOEC. And like the chairman said, they are properly funded. There is ongoing research projects to fast track the elimination process, like innovation of traps, modeling approaches, development of strong drug intervention, and of course, possible reasons. That is, a reinvention is possible in a few areas. That is why we must do active surveillance to address such situations. We have uncoordinated cross-border efforts within Nigeria. I went on a trip time with my driver. Niger Republic. I couldn't tell the difference from Canada because everybody was looking like me, all dark, and you speak the language you want. Until that is addressed. Possible changes in diagnostic needs, methods. Somebody was telling me about what's it called now? Molecular epidemiology. I had to go and dust up some books to start reading. Molecular epidemiology. It wasn't there in my own time. But whether you like it or not, you must follow the trend. What's their plan for 2024? Conduct in-country cross-border meetings. Develop standard operation procedures on cross-border activities. Conduct operational research in states that fall between 2 or more assessments. That is, if they fail 2 or more, mark them. Previous onco-elimination plan must be revised. And then conduct OEM, onco-elimination mapping in Katsina, Bayelsa, and continue to complete epidemiological surveys in 9 states. In conclusion, Nigeria has produced impressive results over the past 9 years as the last result of implementing the elimination of onchocerciasis. I wish I can say that for HAT and HAT. Thank you very much for your attention.
Please standing ovation, please, and a round of applause. He conferred you. I'm standing on the existing protocol. All right, sir, you don't go. There's something from President to you.
Please, I respectfully invite the Vice Chancellor Kumo, Professor Doze, to step forward. I also invite Professor Latif Oladimeji Sonny to step forward. We are going to give them.
Well, distinguished ladies and gentlemen, this is an award of appreciation presented to Professor Latif Oladimeji Sani, Executive Director, CEO, NSP RI Lauren. Having thrilled the global audience at the 48th Ppsn Annual Conference with his landmark presentation on the sub-theme Stored Food Products as Sources of Public Health Concern, dated today, 10th of October, 2024, and signed by our International President on behalf of PPSN. So, Prof, yeah, thank you very much and congratulations. Yeah, congratulations, sir. And the second one is to our living ancestor. You can agree with me, he's one of them. In fact, I'm so happy I'm here today because from the time I joined this uncle walk with Professor Ibom, I kept hearing about Dr. Henry Legere. It's only today I'm seeing who Dr. Legere is, so I'm so excited as I see you, sir. Yes, sir. So it's also another award of appreciation presented to Dr. Henry Legere, founder of my IME Consult in Abuja, having thrilled the global audience at the 48th Ppsn Annual Conference with his landmark presentation on the sub-theme, trypanosomiasis and onchocerciasis, elimination efforts in Nigeria, dated 10th of October, 2024, and also signed by the international president on behalf of our family, the PPSN family. So congratulations, sir.
The Vice Chancellor, please, you still have to stay. Another assignment for you. We are very sorry. Thank you, sir. We also want to recognize the support of the hosting Vice Chancellors for what they've done for us to make this 48th anniversary a success. So we want to invite the representatives of the Vice Chancellor, starting with the host where we are now, University of Uyo. The Vice Chancellor is gone. Can somebody step forward to receive the award to represent the Vice Chancellor, University of Uyo? LOC Chair, you are the one, you are the next in rank. You are a 3-star general at this occasion. Aha.
Yeah, this one is also another award of appreciation presented to Professor Babe Ndaeyo, Vice Chancellor, University of Uyo, having co-hosted the 48th Ppsn Annual Conference held at the University of Uyo, Akwa Ibom, dated 10th of October, 2024, and signed on behalf of the PPSM family by our international president, Professor Eso Samwobo. So congratulations, Prof. Yeah.
Congratulations, Vice Chancellor, University of Uyo. Next, I want to call on the representative of the Vice Chancellor of Akwa Ibom State University, Ikot, Akbadin. Okay, Editor-in-Chief is coming to take that on his behalf.
Thank you. Yet, another, okay, Prof, you're welcome. Another word of appreciation presented to Professor Nseyu Essien, Vice Chancellor, Akwa Ibom State University, Ikoro Badem, okay, having co-hosted the 48th PPS Annual Conference held at the University of Uyo Akwa Ibom, dated 10th of October 2024, and signed on behalf of PPSM family by our international president. Congratulations, sir.
And to make it a tripod stand, I want to invite the representative of the Vice Chancellor of the Federal University of Technology, Abasi, LOC Chair. LOC Chair, please come and receive on his behalf.
Yeah, lastly, but not the least, award of appreciation presented to Professor Leo Darnell, Vice Chancellor, Federal University of Technology, Ikot, Abasi, having co-hosted the 48th Ppsn annual conference held at University of Uyo, Akwa Ibom, Akwa Ibom State, on this day, 10th October 2024, also signed on behalf of the global PPSM family by our international president. So congratulations, sir.
PPSN, my society. Let me shock you. Let me shock you. Okay, I've not had breakfast. I've not had lunch. Maybe I will not have dinner. I'm not fasting, actually. Sir, it's not that bad. Anyway, I'm saying this to realize the fact that a good many of us are way down our glucose levels since morning. So that is noted, please. But we cannot interrupt what we're doing. But believe this is the last phase of this session. Then we'll go for lunch. I've been aware the LOC chair is here. For lunch today, he slaughtered 3 cows for all of you. And he has said that no single piece of meat should go back to the caterers. So please, we encourage you to eat as much as you can. Please. So while you are whetting your appetites and trying to imagine Erika Icon, and etc. And the fisherman's soup. The fisherman's here, for the men who came here, if you are staying in town and a young lady is saying, good morning, brother, be very careful. If you go chop a kaikan, you are not going back again, no? You have been warned. So if you want to eat a kaikan, eat it here. Don't let sister give you a kaikan in town. You are not going back. Mark my words, oh. Sir? All right. We want to recognize the meritorious service given by members of council because, as you are aware, this is PPSN election year. And by tomorrow, the tenure of the current executive will actually expire. So, the council drove this site for the past 3 years. Right, we just want to give a little award of meritorious service to them, to thank them for what they've done, and also to encourage them to do more. Actually, in other enterprise, they find themselves in my society. So briefly, we are going to do that. If you have a timer, Tammy, we are going to spend 40 seconds for all of this. Start the timer. I want to invite the chairman of the BOT, Professor Ekabraid, to do the presentation. So we start with the editor-in-chief, Professor O.M. Epo. Are you timing? 40 seconds. The secretary, Professor Danan Daku. Okay. Professor Martins ICN. Professor Kabir Abdullah is not here. Professor Kabir Abdullah, I don't think I have not seen him. I don't think he came in. Then, so we have Professor Gideon Amuga, the Vice President. Chancellor of the Exchequer, Professor Angela Ekunife. EFCC, Professor Gloria Wokem, Internal Auditor. Professor, Professor Abdullah will visit Professor on his behalf. This is Bonza. He's representing, he's taking for him. Dr. Mercy Ezenwala, the Assistant Secretary, PPSN. The Financial Secretary, Dr. Banji Surakas. IPP. I didn't tell you, Professor Chinwe Ukaga marked her birthday last week, October 8th, October 8th, 2 days ago, actually. So, at AGBM tomorrow, she's going to celebrate it. She has laughed, is correct. So, Professor Chinwe Ukaga, immediate past president. Editorial assistant, Dr. Eiz Adeyemi, editorial assistant. Boko Haram. Sorry, I didn't say anything. The shortest man in council, Professor Innocent Omalu. Don't stand up. Don't stand up, please. She's very short.
The chairman of the Conference Management Committee, Professor Ombolale Oniya.
Want to invite the president, international, that's a new degree got today. The international president, Professor S.O. Sam Wobo, outgoing president, PPSN. Gentlemen, please appreciate the Executive Council. By tomorrow, they will sign out and say bye-bye. You. So please come together for a group photograph. Not one of you. Sorry, I forgot. It's because of this man. It's because of this man. I'll make him to the back. We can't use this. Can you? Go serious. Mine is tall like this now.
Wait, let me remove this. I feel intimidated. Okay. Boko Haram.
All right, thank you very much. How many seconds did we spend? Who is it? Who timed it? Thank you, sir. I told you no more than 40 seconds. So, please, we are going to have a break now to go for lunch. Please hold on. Let's give the information fully. So just some little information, please. Lunch is going to be served outside, just the tent opposite the registration desk. You'll see the caterers there. Right. For the members of the BOT, trustees and council members, lunch will be at the foyer up there in the hall. That is members here. And invited guests, lunch is at the foyer up there. Please, members going for lunch, note that have the leadership meeting coming up immediately after lunch. Leadership meeting is meant only for members of the BOT, members of council, all zonal, okay, they are in council as well actually, all state chapter liaison officers, that is state coordinators, and all the chairpersons of all the branches of PPSN nationwide. We'll come back after lunch. We want to peg that meeting for 5:30 to start. That meeting starts at 5:30, so please take note. Then, on special recognition, Dr. Lebari Bole, please come forward. You would have been seeing him running up and down, very energetic, good-spirited, very dynamic colleague of ours who has been acting and supporting the president to succeed. So they say behind every successful man is a woman. In this case, he's a man supporting the president, right? So Dr. Lebari assists the president, and his gift, unfortunately, was forgotten in the vehicle that brought us in this morning. So though he will get it behind the cameras must record him that he was mentioned for the great feat he has actually done. So please, I will need to take a handshake with the BOT chairman. We will not belabor again to thank you for what you do and what you continue to do. So a BOT handshake. Thank you so much, Dr. Lebari, and God bless you. A round of applause for him. So I want to invite the LOC chairperson for a 3-second vote of thanks to close this ceremony session. Please note, lunch is outside. After lunch, by 5:30, we'll come back for the leadership. That is the last activity for today. LOC chair, please.
Thank you, distinguished PPSN members. On behalf of the LOC, I wish to thank our invited speakers. They have done marvelously well in their respective topics, and we all enjoyed their lecture and the wealth of experience. Once again, I say thank you and God bless you. To our distinguished BOTs, the great men and women, the team and caliber of PPSN, the table shakers, I said, may God grant you great success in your future endeavors. You have supported us. You have been with us. You have given us strength and wisdom to push this conference forward. On behalf of LOC, once again, we say thank you, and thank you. To my great president, the international president, I don't know how to thank you. You are the one I know. And I know you know I know you. Thank you very much. Yes, sir.
So please, once again, the itinerary for the rest of the day, lunch now, PSN leadership meeting at 5:30, expected participants, BOT, council, chapter liaison officers, and branch chairperson of all the branches of PPSN nationwide. Zonal coordinators, please coordinate this and let your members come in by 5:30, please. Thank you. Music. Please, if you are looking for your eyes, I have a set of eyes here. I have a set of eyes with me. If you misplaced your eyes, I've got a set here.